Sure. Yes, good afternoon, ladies and gentlemen. Yes, welcome to the FAWA session on the empowering of veterinarian in facing AMR challenges in Asia, hosted by Federation of the Asian Veterinary Association. Yes, first of all, I would like to greeting especially to our FAWA president, Dr. Aisao Kurauji. And the most important is he's the chair of the Congress, Dr. Kwasa Nizamuddin bin Hassan Nizam, our past president. Yes, and also for all the FAWA counselors and our FAWA guests and ladies and gentlemen. It's really a great pleasure for us to conducting this session. This session is not only on-site, we also live stream via FAWA Facebook. So in this case, you can also inform your friend that they could not have any chance to join us at this moment. They can also find all of everything on the information about the AMR from the Facebook, from FAWA Facebook, and also from our networking as FAWA AMS, and also in the Faculty of Veterinary Science, Chulalongkorn University, Bangkok Facebook. Yes, first of all, the most important, because this is very special session that we really recognize that this is the FAWA World 2023 celebration in the coming 18 to 23rd November 2023. This is a little bit pre-celebration, but anyway, we are really honored to have this seminar in a very, very outstanding session in the FAWA Congress in Kuching. Yes, first of all, I would like to say that I'm the director of the FAWA office Bangkok, and I would like to invite especially our doctors, our special panel. This panel, what can I say? It's not the panel, it's invited speaker today to share the session of the plenary session in the beginning, of course. And also, Dr. Kwasa, he is the chair, he also be the speaker in the first. So at this moment, shall we start with our session? I would like to invite and greeting Dr. Kwasa Nizamuddin bin Hassan Nizam. He is our invited speaker for the first session. Dr. Kwasa has a very, very outstanding biography, especially his academic qualification. He finished his Doctor of Veterinary Medicine from University of Pertanian, Malaysia in 1984, Master of Science in Tropical Veterinary and Epidemiology and Preventive Veterinary Medicine from the Free University Berlin, Germany in 1994, and Fellow of Malaysian College of Veterinary Specialists. His experience, he served as the Director General of the Veterinary Service Malaysia from 5th June 2017 till 9 March 2020. More on that, internationally, he was the Vice President for the Regional Commission of the World Organization for Animal Health for Asia, Far East, and Oceania from May 2019 till 9 March 2020. Currently, he is now the professor of the Faculty of Health and Medical Service at Taylor's University, Malaysia, member of Partnership and Financing Panel for Global Framework for the Progressive Control of Transboundary Diseases, member Policy Committee World Veterinary Association, Director of Malaysian Equine Council, Independent Non-Executive Director Farm Fresh Berhad, and Independent Non-Executive Director Pet World International. Yes, and of course, he is our immediate past president of Federation of Asian Veterinary Association. Yes, please welcome Professor Dr. Kwasa Nisam Madin bin Hassan Nisam on the topic of challenges and the FAWA initiative to tackle AMR in Asia and the Pacific. Yes, please, the floor is yours. Thank you.
Thank you, Professor Dr. Acharya, for the kind introduction. Very good evening, good afternoon. Hope you all had a good lunch, and nice to see you all here after lunch, still attentive to the session. Today I'll be speaking about what we have been doing as the association at the Federation of Asian Veterinary Association. We have taken on board a task with, in collaboration with FAO, on looking at how we can manage this issue about AMR. I think this was spoken, in fact, this morning the keynote speaker mentioned about AMR, I think. There's one slide about AMR. AMR is a big issue, and we need to really get on top of these problems and see how we can contribute to solve, at least at our level, as professionals and so on. How long? Half an hour, is it? Yes. Thank you. I think this slide is a very important slide. I show this slide to everybody. I think a lot of you probably have seen. It's very important information which was projected in 2014. What will happen moving forward if we don't do anything by 2050? Everybody using 2050 as the sort of timeline to look at what we can achieve. 700 deaths annually worldwide. That was projected in 2014. I'll tell you, I think Dr. Kachan mentioned, but I'll show you a slide later. Actually now what is now happening. 10 million deaths, that's what we call silent pandemic. Yeah, 10 million. 100 trillion of economic losses. That's what we'll end up with if we do not get our act together, right? So where should I point now? Why is it not moving? Move back. Oh, that side. Oh, it's there. Okay, the epicenter, the hotspot is Asia. If you look at the projected mortality, 4.7 million. So even Dr. Kachan has said, the per capita income is going up, the animal protein requirement is going up, and there'll be a very intensive livestock production in the Asia region. So we will be affected wherever we are. We are all here. We are now here, the Borneo Islands. So yeah, that's a projection. And this latest data, you look at what's happening. This is projected from 2020 to moving forward to 2030. And China is one of the biggest consumers of veterinary antimicrobials. And you see the rate of increase. Even a 1% increase is about 31,000 metric tons of antimicrobial use. And the type of antimicrobials, tetracycline is up there. Then you have the penicillins and macrolides. You see here, Asia is the biggest area where we consume antimicrobials. So 73% of antimicrobial use is used in animals. So the humans are using, or rather humans and maybe plants and so on, less than that. 73 is with animals. 79.3 milligram uh, population concentration unit. This is the measurement they use to compare between the intensity of antimicrobial use. So it's at 79.3. Of course, it varies. China is way up there. Where a lot of antibiotics are used, 243 in sheep, pigs about 173, cattle 59, and chicken 35. So that's where a lot of antimicrobials are being used up. So I'll show you later what's going to happen in the next 10 years. These are all the issues which is present. These are challenges in Asia. Legislation, some are inadequate, some of the countries. Then you have guidelines, treatment guidelines. A lot of countries have, some countries have, a lot don't have guidelines. Easy access to antimicrobials. Self-administration, used for non-therapeutic uses. This, like AGP, still being used in a lot of our countries. Although some have started banning the use of AGP in feed. Withdrawal period are not given due attention. I'm sure you all know this. Farmers give towards the end of production cycle, and then it gets into as a residue in the poultry meat and so on. Surveillance is often mentioned, not enough. Information sharing. This is another big area on infection prevention and control, and poor quality counterfeit drugs. I think Dr. Ronello will be talking about this also on Sunday. Okay, so what happened was realizing the importance of AMR and what we need to do. We started this journey from 2020 with FAO, looking at how we can manage this problem. And we are trying to, we are from the association, to see how vets can be involved, veterinary association and vet students. How can we be involved? Of course, it's a big issue. You have the human sector, and then you have the environment and so on. But we are focused on what we can do to help mitigate the issue about AMR. So we ended up having this FAWA strategy to tackle AMR 2021 to 2025, right? So what is it all about? This is, we have worked and published this guideline, or the strategy, which actually aligns itself to the Global Action Plan on Antimicrobial Resistance. So this is available to be downloaded. And what actually is in the guideline is, or rather the strategy is, we are clear what we want to do, and we want to monitor and evaluate what we have done and what is the impact in this strategy. So what is the vision? It's very clear. Prudent use of antimicrobial, prudent, responsible, and appropriately. We want to use, that's the message we want to send across. I'm talking to fellow colleagues, the veterinarians. This is what we have to take note of. And of course, all the activities program activities will be targeted toward reducing this AMR issue. And that's how the mission will be carried out. So I'll show you the activities we are doing later. So of course, the goal is to reduce the risk of emergence and spread of AMR, while animal health, production, and welfare is ensured. Then practice of vet medicine is enriched at the national, international, and regional level. And of course, not forgetting the quality of life. When people don't die of AMR, that is what we expect I mean, that's the end result. We want to have less and less issues with AMR in humans. So we developed 5 strategic objectives to tackle this problem. Of course, awareness. That's number 1, awareness. Veterinarians, through the associations, students, that's what we want to target. Then on the surveillance, on the use of AMU, antimicrobial use, and also the resistance. And infection prevention and control, that's the 3rd one. And 4th is on the antimicrobial stewardship program. And the last one is on the governance, strengthening the governance and sustainability of efforts in this. So these the guiding strategic objectives in trying to mitigate the problem of AMR. So I'll just go through from 2020 we started, then we have this strategy going from 2021 right up to 2025. So I'll show you what we have done over the many years and what are the challenges we are facing, what else needs to be done. So if you look at the awareness, the relating back to the earlier strategy objective, the number 1 is awareness. This is something which we have worked hard on to create this awareness among veterinarians, veterinary associations, and also the students. So these are all these webinars. You look at the dates since 2021. We have been doing with different associations. We have 7 member countries in these webinars. Yeah, these are all done way back since, like I mentioned, the strategy is from 2021, and we have done in all these different countries, the regional satellite seminar, in Malaysia, in Thailand, and so on. And this was in 2023. This is quite recent. 2022, and this was also in Fukuoka. We had a booth in Fukuoka FAWA Congress. See? Familiar face. Yeah. This is Dr. Joy. She'll be speaking later. Yeah, she's around, right? And this is in Indonesia, 2022. We have all the local speakers. Oh, what's happening? Why is it? Sorry about that. Sorry, I'm not handling this properly. So this was in March. We had lunch talk with the industry players. So just talking and creating the awareness about what we need to do, what needs to be done. That has been very, shall I say, impactful to us. Show you some more. This is with TVMA. This is in April 2023. It's a lot of students. So, okay, this just to give you a summary of how many people we have targeted, how many people have been involved in this awareness program. 200 students, 2,000 veterinarians, 14 member countries from FAWA. We have Facebook, Instagram. The queen of Facebook is here, Dr. Corazon. She's so active, taking all the photographs and so many followers. Later I'll show you, under the AMS, we have hundreds of thousands of followers, in fact. So all this creates that right discussion and thinking on these AMR issues and how to mitigate the problem. So 26 webinars we have done, 10 member countries, average of 250 participation from the vets itself. So this an ongoing effort which we think will bear fruit. That's the first objective. That was on creating the awareness among veterinary students, veterinarians, and the associations. This on the surveillance part. In 2021, Professor Bambang is here. He, under his leadership, we conducted a regional survey among 7 countries on the common bug drug combination in major livestock in Asia. Professor Dr. Mary Joy was also involved with us on this. And this was trying to look at what is happening really on the field with respect to the pathogens and what about antibiotic sensitivity testing and so on, and isolation. So these were the total respondents, just briefly. And what is interesting is bacterial isolation was never done more than 50% of the time. Okay, in the last 3 years of susceptibility testing, almost 50%. So these are real issues. And you see these are some of the different species, swine, cattle, poultry, and aquatic. And see, common diagnosis is scours, pneumonia, scours, right? And similar, mastitis, E. coli, mastitis. These are a pool of 7 countries, which was surveyed. And poultry, colibacillosis, and CRD, coryza. So this is what was identified as what was isolated. And what was used for treatment, this is what we wanted to find out. Using all these same things. And you would know that this drug, they become resistant, and this drug is still being used to treat for all these problems. So probably because of availability, probably because it's cheap and so on, they still keep using the same drugs which are actually not effective anymore and will cause issues. So we got the results from all these surveys and so on, and then of course we conveying these results and telling what we found, what needs to be done further. So we have the webinar as a follow-up, right? That was in March and then April, so that we inform our people who are involved with us in the FAWA member countries about what we found and what needs to be done, what further action needs to be undertaken. Let's look at the infection prevention and control measures. So we started this house design competition since 2020. This for the poultry housing. The idea is to let our veterinarians in the FAWA member countries to come up with some designs which can be used with the intention of looking at how to include biosecurity features and costs, and it costs at a reasonable cost, right? So we had a competition. We had vets sending in the applications, and we have many proposals, and of course we had a competition. We had prizes given away. And this was 2021. This was on swine house design. So we have one on poultry, one on swine, and then followed with, it's not effective, this. You press, it doesn't go, and then suddenly, can somebody help me? Okay, 2021, where? Up there. There? You have a point there, is it? Oh, there. See, there's a small thing there. My God. Sorry about that. This was on the swine house design. We had good participation from all the different countries, Bhutan, India, Indonesia, and so on. And then we shortlist and then decide who are the winners, and they have to present it to our member countries through a webinar we have. This is talking about good farming practices, specifically just done in March. So 133 vets on site, 456 viewed live stream, and 3,000 vets involved. So this is, so we have awareness, we are talking about infection prevention, all these are being done continuously to support our power strategic plan. So, of course, we are here. That's why Dr. Acharya is here, trying to promote this design contest and so on, Power Congress. Okay. AMS. AMS is, sorry, I didn't mention the awareness. We have lead persons leading each of this strategy, so that we are all accountable, because at the end of the cycle or session, we have to present what we have done. Like the first one on awareness, Professor Acharya is the one responsible, and then for surveillance, Prof. Bambang is the one is in charge. And the third one, Professor Acharya, she takes care of the two strategy objectives. And this one is under Dr. Isao Kurauchi and also Dr. Corazon, the antimicrobial stewardship. I was showing all the slides. It's not all my work, it's all our work together. So this was done since 2021, and working together to promote antimicrobial stewardship in animal sector in the Philippines. This was in was this 22? This is in Vietnam. It's in Vietnamese language. We just localize it. This figure was given by Dr. Corazon. 350,000 Facebook users on the FAWA antimicrobial. Don't you think it's impressive? We have reached out to so many numbers. And so many people have seen these articles, trying to reach out to students. These are the efforts we are doing through the FAWA collaboration. Establishment of One Health Office in Fukuoka. I think someone will speak more on that. I think Dr. Kurauchi has got a presentation also. This is, the AMR will come under this work. So we have established this One Health Office in Fukuoka. And then these therapeutic guidelines is being prepared in Philippines. And we also translated the Japanese therapeutic guidelines to be used as a reference for other member countries to look at and probably come up with their own. On governance, this is a bit difficult to do. Of course, we have the Power Strategic Plan, and on this is the monitoring and evaluation. This is the difficult part, but we have to ask the right questions. What are we doing? Are we achieving our the objectives, and what are the shortfalls and the challenges? So it's work in progress. This is how we measure our success, what we are doing, asking about the educational activities. AMR mitigation pledge, this will be later be presented by Prof. Acharya and Dr. Corazon, I think. And CPE, the continuous professional education, and do the countries fund independently this WOW campaign. So we have a list of, for each of the objectives, the questions we ask the member countries as to how the progress is, so that we can closely follow what is happening in terms of the AMR or measures taken to tackle AMR. This is a bit difficult. looking at whether the standardized, how many veterinarians are trained on standardized method on AMR, AMU use, whether we can increase the bacterial isolation and AST by the laboratories in each of the member countries. So these are still work in progress. We still have the plan working through until 2025, and some of it are still work in progress. This is about talking about tools, the number of tools and platforms that promote good animal husbandry practices and the training and workshops. And this is another area we are trying to work with the associations to see how we can improve on the resolutions or agreements or legal basis in terms of pre-use, post-use, and practices on antimicrobials. So, Dr. Joy, we need to work on this to see how we can achieve these goals which we have set for ourselves. And this on the policy, on the governance and so on. This is about supporting policies at the national level, how FAWA can work with National Veterinary Association to try and help National Veterinary Associations to push for policy changes and so on. So way forward, other efforts are being undertaken. Later, after the break, you'll hear the additional efforts being undertaken by FAWA. But we continue to implement the FAWA strategy for 2021 to 2025. Encouraging news. It has been reported that use of antimicrobials in animals have decreased 27% and 34% from 2015 to 2018. The use of AGP no longer practiced in nearly 70% of reporting countries. Then these are the success stories, right? Thailand has reduced, UK has reduced, China and so on. Okay, that's the encouraging news. But what is the outcome, at least as we are reporting now? If you remember, in 2022, this is reported, 1.3 million deaths directly from antimicrobial resistance. Projected in 2014 was, if you remember the first slide, 700,000. But actually it's up to 1.3 million. That means we have to do more work, whether it's the animal sector or human sector, environmental sector. So now we have the quadripartite, and of course Dr. Joy is working hard on this. Then the projection shows, 99,000 tons are used, projected to increase by 8% to 107,000 metric tons by 2030. And the intensity, if you remember, we mentioned 2020, 79.3 to 85.6. Okay, this is what is happening currently. Third Global High-Level Ministerial Conference, all this was said. This is in November 2022. Reduce the total amount by 30 to 50%. You see a projection of increasing, and here at the high level, we are talking about reducing 30 to 50%. It's going to be a real challenge. What are we going to do? What are we going to do? Like Dr. Kachan said, I don't have the answer. We all have to think about this. We all have to work towards trying to bring it up. Here, the projection says, 8%. But the vision is to reduce it by 30 to 50%. Okay? Then, of course, it says about zero use of medically important antimicrobials for human medicine in animals and non-veterinary medical. Ensure the SS group. This for the human sector. Use narrow spectrum. Of course, doctors are, I think there's a doctor here from Japan. There's a doctor here. So it says use narrow spectrum, not broad spectrum. So these are high-level discussion Muscat. They made and this is going to go into the, I think, WA session, and I think it's going to be signed off, I think, or in the United Nations to be adopted. So, in conclusion, the take-home message for me, for you, and for all of us as practitioners. At least can we remember to use antimicrobials responsibly, prudently, and appropriately. Thank you very much.
I was just curious on how do you collect the data that there is a decrease in the use of antibiotics?
Okay, the slide which I presented was data from World Organization of Animal Health data, which says there's a decrease. It's in the website. It's reported, they collect the AMU data, antimicrobial use data, and it is reported. I think that's the latest one, which was done in 2022, which is now available, and that's what it says. The report says from the World Organization of Animal Health.
Malaysia, right?
Collect, it's from the countries. They have to report the antimicrobial use from each of the countries, like Malaysia, Thailand, and so we report. There are formats, templates sent out to each of these countries, and the government, or rather the veterinary services in each of the countries, send the data to World Organization of Animal Health, and they compile it and do the analysis and publish the data as as how much is used in terms of AMU.
Any other question? Any? I think we don't have it. Yes. Shall we continue for the next? You would like me to introduce? Yes, please.
Thank you very much. Actually, I'm presenting. I'm also a session chairman. So 2 in 1. Okay, we'll move on this session on this. We have the next speaker is Okay, we have Dr. Rohaya here. Dr. Rohaya Ali is the Senior Director for the Department of Veterinary Services. She'll be speaking as the next speaker. She's got a degree from Doctor of Veterinary Medicine from Institut Pertanian Malaysia in 1990. Current position, Senior Director of Veterinary Public Health Division, as well as Acting Deputy Director General of Veterinary Health. Her field of expertise is on she has been working for 14 years in veterinary diagnostic and veterinary public health laboratories, wide experience managing disease control and surveillance program for various diseases, including HPAI in Kelantan and rabies in Sarawak in 2017. Currently, she is the national focal point for antimicrobial resistance and coordinator for National Antimicrobial Resistance Committee in the animal health sector. So she's got a lot of experience on AMR. She's from Malaysia. Dr. Rohaya Muhammad Ali, silakan. Please.
Thank you, Datuk. Bismillahirrahmanirrahim. Assalamualaikum and very good afternoon to all. Okay, today I will be presenting about tackling antimicrobial resistance in food producing animals in Malaysia, initiatives and challenges. So this is the content of my presentation. I will cover introduction, DVS initiative in tackling AMR in animal health sector, challenges and recommendation, and the last one is conclusion. So for introduction, I would like to introduce to you about my department. My department is the Department of Veterinary Services Malaysia. DVS Malaysia was established in 1860 and is located in Putrajaya, Malaysia. So the vision of DVS is a competent veterinary authority serving the animal industry for the sake of human welfare, and the mission is to provide quality veterinary services as an assurance for public health and sustainable livestock and industry for the sake of human welfare. So these are all the objective of our department. So currently, this our current legislation. We have Animal Act 1953. We have also Animal Welfare Act 2015, Feed Act 29, Surgeon Act, and also we have many or several SOPs and guidelines to support our activity. We also refer to the terrestrial animal code, animal health code from WAH as a guideline. So this is an overview of antimicrobial resistance. I think Dr. Ketchen and also Dato already covered about this. I think I can skip this. Okay. So for your information, the population of livestock in Malaysia for 2018 until 2022 as on the screen. So the largest population of livestock is chicken, followed by duck and pig, cattle, goat, and buffalo. Okay. Okay. The demand for cheap protein sources from food-producing animal product is increasing worldwide. So this will lead to an intensive increase in livestock production to meet this increased demand. And we know the risk of AMR in animal health when the antimicrobial no longer to be effective as a treatment and will increase the rate and morbidity and mortality due to the difficulty in controlling the infection. So antimicrobial resistance also recognized as one of the major threats to animal, human health and environment. It has implication for food safety, food security and economic as a whole. This make MR a problem that cross border sector boundaries. Not move, not moving. Oh. Okay, now we move on to DVS initiative in tackling animal health sector. As you can see here, there are about 10 key MR initiative in animal health sector done by DVS so far. First is involvement of animal health sector in the National Committee on AMR, or we call National Antimicrobial Resistance Committee. Second, DBS contribute in the preparation and establishment of the Malaysian Action Plan on Antimicrobial Resistance, MAEPS AMR, for animal health sector. Next, development of AMR surveillance program in animal health and veterinary laboratory capacity building. We also take the initiative to strengthen AMR research. We develop policy and antimicrobial usage on antimicrobial usage. We also established the roadmap for phasing out medically important antimicrobial usage as AGP and prophylaxis. We took the initiative for antimicrobial usage and drug residue monitoring. We also take initiative to enhance awareness, education, and understanding about AMU and AMR, and also strengthen farm biosecurity. And lastly, we promote the use of vaccine. So for the initiative number 1, involvement of animal health sector in the National Committee on AMR or NARC. So actually, Malaysia, DVS especially involved with the MR since 2017, when we took the initiative to establish the NRC through the One Health approach. Prior to that, the MR already taken by UN in Geneva by UN General Assembly Political Declaration on MR, and the establishment of the tripartite, which consists of WHO, FAO, and OIE. In conjunction to that, we also developed the MR or action plan for AMR for 5 years, started from 2017 to 2021. This is by One Health approach between Ministry of Health and Ministry of Agriculture and agro-based at that time, agro-based industry. So, the MyApps MR or action plan for the first phase was ended, and now we are in the implementing of the second phase of MyApps MR, which is from 2022 until 2026. So this is the structure of the our National Antimicrobial Resistance Committee, jointly co-chaired by DG of Health and also DG of Veterinary Services. So under this NRC, we have 4 technical working group, 1, 2, 3, and 4 with their respective strategic objective that have been set. This is just to show you the members of NRC. We have multi-sectoral coordination from many agencies and also NGOs. The second initiative is a contribution of DVS in the preparation and establishment of the Malaysian Action Plan on Antimicrobial Resistance. This is our first MyApps or action plan on AMR from 2017 to 2021 with the objective strategy, awareness and education, surveillance and research, infection prevention and control, and the last one is appropriate antimicrobial use. So the third initiative, we developed the AMR surveillance program and also the veterinary laboratory capacity building. So DVS strengthened the annual animal disease surveillance program by integrating active and passive AMR surveillance program started from 2018. So the objective is to determine, monitor the prevalence of AMR and to provide more complete picture of antimicrobial resistance that can facilitate analysis of trend over time and across animal sector. We do also collaborate with international organizations such as WHO and FAO for AMR surveillance training and laboratory capacity building. We do also harmonize One Health AMR surveillance, including laboratory methodologies, data analysis, and reporting. Besides that, we also explore the monitoring tools such as whole genome sequencing and other molecular-based methods to improve and add value to our surveillance data. So for your information, our AMR surveillance program carried out continuously for Salmonella species and commensal bacteria, which is E. coli, from healthy food producing animal and product of animal origin. So the source of sample is from farm and processing plant. The animal species involved are layers, broilers, and pig. The type of sample we collect feces and also chicken and pork meat. All samples were sent to nearest veterinary laboratory. Actually, we have about 6 laboratories, including Sabah and Sarawak, for bacterial isolation and diffusion. Type of antibiotic tested, we actually have about 10 type of antibiotic as listed here. So from the finding, AMR trend over 5 years, from 2018 to 2022, of Salmonella species and E. coli isolate in broiler, layer pig, chicken, and pork meat were found to be high prevalent, which is more 50% resistant to erythromycin, tetracycline, ampicillin, chloramphenicol, streptomycin, and sulfametazole, trimethoprim. So this is just to show the position of our laboratory. So we have 8 regional diagnostic and 7 regional diagnostic and 1 veterinary public health laboratory and 1 research laboratory. So another initiative is strengthen AMR research. Usually we have the collaborative effort between DVS and other agencies such as UPM, AMR, and also international body. And also This research is to reduce evidence gaps and improve understanding of the risk of MR in the environment. So we do also develop a policy and guideline on antimicrobial usage. Malaysia has established an MR policy by prohibiting the use of critically important antimicrobial CIA in human and also veterinary critical important antimicrobials VCIA. So implementing this MR policy is to reduce by phase for certain antibiotic. So, prohibition the use of AGP and prophylaxis in food producing animal in stage by 2025 under Feed Act 2009. So this is the roadmap for phasing out medically important antimicrobial usage as AGPs and prophylaxis. So in 2021, a total of 6 antimicrobial have been banned, which is erythromycin and rofloxacin, tylosin, cetirizine, tetracycline, and fosfomycin. Then after that, we developed a 3 years roadmap 2023 until 2025 to guide the phase out about 23 more medically important antimicrobial as AGPs and prophylactic. Another initiative is a pharmacosurveillance program. The pharmacosurveillance program was carried out periodically on premises. We conducted the thorough inspection of records, stock, and inventory in all animal premises, such as animal clinics, pet shop, feed millers, livestock farms, and medicine warehouse. This is to ensure the activity of distribution, prescription, and dispensing of antimicrobial and vaccine in accordance to national legislation. So, from our monitoring, antimicrobial usage monitoring, we found that the trend of antimicrobial sales data from 2017 to 2022 showed the reduction over the 5 years. Maybe this is because our policy prohibition of the antimicrobial usage. Okay, this graph shows the most highest and frequently used antimicrobial in animal health. We can see here chloroquinolone is the highest, and then followed by penicillin and also tetracycline. So another initiative is awareness campaign and education of MR and AMU. So we conducted many channels for awareness, such as social media, mass media, electronic media, and also seminars and workshop. And also we do the survey. Okay, we also develop and distributing of posters and pamphlet to target audience. This is just to show the campaign material that we have developed. This is another initiative for awareness. We have developed antimicrobial resistant awareness toolkit we call ARAT for training of trainers program. Also, this the training that the workshop and the seminar conducted. We also organizing the World, never miss, organizing the World Antibiotic Awareness Week every year. So you can see here every year, 2017, 18, yeah, okay. So this is just to show some media coverage on AMR in animal health. Okay, another initiative is strengthen the farm biosecurity certification scheme. So DVS has introduced Malaysian Good Animal Practice, MyGap, and also Malaysian Organic Farm, My Organic. So this is the program is established in 2013. So we also have the Malaysian Standard for Good Animal Husbandry Practice. This program actually to ensure the production of quality and safe livestock product for human consumption, and also the safety of the welfare of animal and the quality product and safe for human consumption. The last one, I think our initiative is to promote the use of vaccine in order to prevent the existence of disease, controlling the spread of disease, increase the animal immunity, reducing the use of antimicrobial in animals. Just to show you the number of animals vaccinated according to the disease in vaccination program, we have, I think this is under just only under control by DVS. We have the Brucella, FMD, Newcastle, and also HS, and also rabies for dog. So now I move to challenges and recommendation. There are several challenges. First one is awareness of MR for behaviors change is still not satisfactory, must be carried out continuously, particularly among those who are involved in livestock production and aquaculture. So we also always lack of funding. In order to strengthen MR surveillance, AMU monitoring and awareness program, we need actually educate funding. So the lack of measuring antimicrobial usage at farm level. This is due to the lack of resources and expertise to gather the information and interpret of AMU data. Lack of enforcement and monitoring to prevent misuse and limit the use of antimicrobial in animal, especially food-producing animal. For example, a veterinary prescription is required before antimicrobial can be administered to animal. So another challenges, poor governance at the national and state level. So we would to suggest improve governance to produce better. Oops, sorry. Okay, another challenge is still lack of research conducted related to MR and MU. More research needed to be done by providing more fund or matching grant to the researchers. The coverage of surveillance program is very limited and has not yet been extended to other animal species, pathogens, and antimicrobials. So the last one is participation by industry player and agencies, still not comprehensive. Lack of farmer cooperation to report the use of antimicrobial to the veterinary authority. So last but not least, this is my conclusion. So the conclusion, the Ministry of Agriculture and Food Security and the Ministry of Health have been working together to address the AMR problem in Malaysia, as the AMR is a major threat to food security and food safety in the country. In the animal health sector, the US, together with stakeholder livestock industry players, farmers and veterinarians, committed to implement the National Action Plan in minimizing the emergence of the AMR, and then the spread of AMR should be slowed down and reduced to maintain the effectiveness of existing antimicrobial drugs for animal and human treatment purposes. With that, I end my presentation. Thank you.
Thank you very much, Dr. Raya. I think very excellent. A lot of work being done in Malaysia. All the best. I think. Are there any questions you want to ask Dr. Raya? Please. I think there's so much activities being undertaken, and there's a lot of achievements there. We hope good things will happen in Malaysia. More AGPs should be removed. But they have a plan that is phasing out and so on. So any questions? Quick question before we start the next presentation. There's a survey here. Please take your time a bit to look at the QR code. Then you can collect some souvenirs downstairs and also your CPD points. So please scan the QR code. So is there any questions? Can we... Quick question? No? Everybody's okay? Fine? Good, thanks. So can we move on to the next speaker? We have with us today Dr. Kohi Makita. Is a veterinarian with a background of local, who has got a background as local animal health officer and professor of veterinary epidemiology at Rakuna Gakuen University, Japan. His research interest is controlling animal infections and zoonotic diseases through One Health in Japan as well as in Asia and Africa. He's the head of Collaborating Center Consortium for Food Safety and a visiting scientist of the International Livestock Research Center, ILRI. He serves as an expert in the AMR Working Group of the Food Safety Commission of the Cabinet Office of Japan, particularly on risk analysis. I think very important person. Has a lot of experience. He'll be talking on, he's also the chairman of the FAWA Standing Committee. We are very happy to have him as a chairman. He's a very important person. He'll be talking on the FAWA Strategic Plan 2021 to 2025 on AMR and what is the current situation with respect to the members' participation and so on. So please, Dr. Makita, your floor is here.
Okay. Thank you very much for the introduction. Professor Kwaza, and good afternoon, everybody. By the way, I'm very new to FAWA. I'm still in the learning process. So I'm here for not teaching something. So I hope we can think necessary things together to combat AMR problem. So, yes, okay. So I point this way. To move. Yes. I'd like to skip some of the slides, luckily, because they are covered by Professor Kwazi. So he talked about the challenges in AMR before 2021, and he covered about FAWA strategy to tackle antimicrobial resistance 2021 to 2025. We are very grateful to US aid. It's very great contribution to the region of Asia. Vision and missions are already covered, so I can go to the next goals covered. Briefly, if I remind you, the first one was to reduce the risks for the emergence and spread of AMR. And the second one was improve the practice of veterinary medicine and promote its national, regional, global relevance. Then third, Professor Kwazi also emphasized that those two will work on the improvement of quality of people in this region. Yeah. Okay, so here Professor Kwazi already covered, but let me remind you, it's like a washing brain things. Number one, increasing awareness and understanding of AMR, right, among veterinarians and students, and also veterinary associations. It's very important. And number two, contribute to regional and national efforts on surveillance and research on AMR, MU, and residues in animals. Number three, advocating good practices in infection prevention and control, because if we can prevent infectious disease in animals, then vets don't need to use antimicrobials. And four, antimicrobial stewardship, AMS. And number five, strengthening governance mechanism and sustainability of efforts to regulate the use of antimicrobials. Here, you can have your questions in your head, because I myself also had a question. This is the meeting in FAVA, Veterinary Association site, but how can we achieve governing the mechanism? So you can have a question for further discussion later. Yes. Then, if you look at closer into the number five, governance, there are three items listed in the strategic plan. First is contribute to the development of evidence-based policies and strategies, and their implementation, as well as in improving regulatory framework and enforcement. Then two, provide veterinary contributions and support to the development and the implementation of the multi-sectoral and the multidisciplinary national action plan. And the third, which is important, I think, monitoring and evaluation, because there was a question of how did you quantify the volume of antimicrobials, right? How unless you have a good surveillance system, isn't it? Yeah. Okay, so I skipped most of the overlapped parts. Then I start talking about what we have done this year. We did questionnaire survey for the current situation of the FAVA members. The questionnaire was designed by the FAVA Standing Committee on Pharmaceutical Stewardship. And thank you very much for everybody, because I was very new. I'm not sure, I didn't know much about the efforts before. And survey was conducted in July 2023 by emails. Okay. Then items in the questionnaire covered AMR action plan development in each country. Item two, details of AMR action plan in each country. And item three, current status of AMR countermeasures based on what we explained repeatedly about those strategic plans. I gave the SP, means strategic plan 1 to 5. Okay. Then, by the way, this strategic plan is very well written. I really wish you have a chance and take a time to read through the documents. And maybe you have can I borrow this? Yes. Okay. Thank you very much. Yes. Yeah, yes. Okay. So the QR code on the bottom. Don't read now because you miss my talk. Thank you very much. Just joking. Yes. Okay, so more specific activities are planned in the document, and there are many more than one. But we selected representative actions for specific SP 1 to 4, and divided into two areas for SP 5, which is the governance part. And this is strengthening research and development and drug discovery. And the last one is promoting international cooperation. Okay. Then finally, the question included request to FAVA on these 6 areas. I hope I didn't introduce unnecessary word of areas, but yeah, it's same with the strategic plan 1 to 5. Okay, the results, response rate was unfortunately very low because of several reasons, probably. Unclear explanation, probably. I didn't have the online meeting beforehand for the mobilization of National Veterinary Association. Sorry about that. Then associations respondents are listed here. Thank you so much for your contributions. Okay, then item 1, the results about action plan development. So those are the questions. So I'm going to explain. So are you familiar to FABA AMR action plan? 85.7%, which is somehow good. And AMR National Action Plan is developed 100%. Congratulations to the region. The organizations which develops AMR National Action Plan is, of course, 100% by the government. Then you can see some limited contribution by the veterinary associations in these countries. Others are the universities and public health partners and NGOs. Okay, the details of AMR Action Plan, National Action Plan includes provision of veterinary medicine, 100%. So congratulations to that. Then areas of veterinary medicine specified in the action plan listed like here. Pet animals, 71.4%. Congratulations, because this FABA is jointly developed by this strategic plan is jointly considered by FAO, I think. Yeah, but you can see FAO is here. FAO works for livestock. Then those pet animals, sometimes livestock, but mostly not livestock. So it's covered. Fisheries covered, and the environment still has a limited proportion of access. Okay. Then target areas in the National Action Plan covered. You can see the high proportion of all the areas, all the strategic plans. So the National Action Plan is very well in line with Global Action Plan, because FABA National Action Plan is also following Global Action Plan. Okay. Then now move on to current status of AMR countermeasures in these 7 countries. So area 1, promotion of public awareness and education. As you have seen many photos in the previous presentations by 2 presenters, those activities are very well performed, I think, in all countries, I imagine. Then area 2, strengthening trend surveillance and monitoring. Surveillance and monitoring of AMR trends is done by 85.7%. And the publication of the results of these activities, 100%, excellent. And the publication and the explanation of the results of the surveillance, which is different from publishing only the government results, can be a little bit limited, 71.4%. That's the reality. Then if you move on to strengthening infection prevention and control, this on-the-job training, on-the-job technical guidance and training was done in the many countries. And the technical guidance and training through webinars, symposium is also done by 71.4%. And provision of information on technical guidance for the prevention and control via website is 71.4%. Others are having a regulation of standard farms. For probably it's industrialized farms and hygiene management handbook for livestock farmers. Yes. Then promotion of appropriate use of antimicrobials is done by on-the-job training, guidance and training, 100%, and technical guidance and training on the prudent use of antimicrobials. Through webinars, symposium is highly uptaken. However, provision of information on technical guidance for appropriate and prudent use through website is limited. Here is, I think I noticed some unreached area of the use of website in each country. Yes. And for research and development and this drug discovery, you can see the percentages are not that high compared to the previous slides. See, promote the development of antimicrobial agents, vaccines, diagnostic reagents, 71.5%. Then next one, I want to draw your attention. Promote appropriate and prudent use of human pharmaceuticals, obviously using for animals, by converting these drugs to veterinary drugs remains 42.9%. So that's the extremely important but not fulfilled area of the target in future, I think. Then provides information on the strengthening of research and development and drug discovery through the website. Also has not got much attention, but it sometimes makes sense to me too. And promotion of these activities through webinars, symposium, remains low. Okay. Then area 6, promoting international cooperation. Technical training on overall countermeasures against AMR for other countries remains at 57.1%. Okay. Establishment of systems for joint development, mutual approval and licensing, etc. of veterinary medicines with other countries still low, and provide information to other countries through your website low. So here also transparency is not achieved, but in order to have transparency, then again you need to have a good surveillance system, isn't it? How representative you have got the information, then if you have the confidence in the information, then you can go for the dissemination of the results through websites, which ensures transparency within the region. Then holding webinars, etc., done by at 57.1%. Okay, so let's move to request to FAVA. Again, so please keep your mind, is this request going to FAVA or going to FAO or going to where? Yeah. Yes, thank you very much. I'm coming back to conclude. Yeah, so because I wanted to everybody to realize, you see, so that's how can I say, the nature, the reality of the problem we are facing too. So the promotion of public awareness and education still wanted, there's a needs to further, although each country are doing very well. Then strengthening trend surveillance and monitoring, provide information via websites and the symposium, technical training of surveillance and monitoring. So maybe, for instance, if we get information from member countries and ensure transparency through websites, training, whatever, I think it becomes a good contribution to the region. Then area 3, strengthening infection prevention and control. Those two high items were provide information via website again, then technical training on the prevention of infectious disease and strengthening of hygiene management, which is very makes sense to me. Okay. Then 4, promotion of appropriate use of antimicrobials. So information provision is still get high needs and technical training. And preparation and provision of antimicrobial treatment guidelines. Maybe it can be helpful. I see Malaysia may develop a guideline, but it can be good to have a FAVA guideline together with FAO. I'm aware that the FAO is working, so there can be some top-up collaboration. Strengthening research and development and drug risk discovery. Promote the development of antimicrobial agents, vaccines, diagnostic reagents. It's hard, isn't it? It should be done by research institutes or some wealthy pharmaceutical companies. Well, but can we work together? Maybe FABA can do something. Promoting international cooperation. Technical training on overall countermeasures against AMR. I've come from War Collaborating Center for Food Safety, so I see the strong requirements not only to the FAVA but also WAR, FAO, and related institutions. So maybe we should consider putting efforts together. It's good, would be good. The summary for AMR National Action Plan, veterinary medicine is well focused in any country. Involvement of veterinary association in developing AMR National Action Plan is limited. And inclusion of environment is still limited. Okay, then the summary for the strategic plan, plan 1, awareness and understanding, promotion of public awareness is in place. And there's a still demand for the provision of information, up-to-date information probably, or transparent regional information from FAVA. And 2, contribute to regional and national efforts on surveillance and research, and on AMR, AMU, and residues. Surveillance and monitoring is mostly in place. The results are published, but public communication explaining what the results mean may be improved. There's a demand of the provision of information and training about surveillance and research from FAVA. But again, so training maybe better come from FAO or WOA or all together. Yeah. So, okay. 3, advocating good practices in infection prevention and control. So technical guidance for infection prevention and control is mostly in place. And there is a demand of the provision of information and training on hygiene management from FAVA. Again, potentially opportunities for training. Trainers of training. What's it? How do you say? Trainers of training. Thank you very much. Training of trainers. Thank you very much. Of local vets and students, because you see that's a strong point for FAVA and the Veterinary Association, because we can reach out to each single veterinarians, isn't it? Okay, yeah, thank you. And 4, promoting AMS. OJT and the webinars are mostly in place. There's a demand of the provision of information, training, and guideline for each animal species from FAVA. Guidelines, maybe we can target cats and dogs because FAO has done livestock. Okay, and finally, oh, maybe I missed, did I miss? I'm sorry. Yeah, 5, strengthening governance mechanism and sustainability. Promotion of the development of antimicrobial agents, vaccines, diagnostic reagents is limited. Promotion of converting human drugs for animals to veterinary drugs is limited. And promotion of international cooperation is still limited. So there's a demand of the promotion of developing drugs, vaccines and diagnostic reagents, and the international cooperation from FAVA. So I wouldn't say anymore because I talked already these things. Maybe coordination is needed. So the final discussions, the FAVA AMR strategic plan is mostly well implemented. And number 5, strengthening governance mechanism is still limited, to be honest. And clear coordination and responsibility sharing with FAO and the WOA may strengthen overall activities towards global AMR action plan. Direct access to veterinary practitioners and vet students may be the strongest advantage for FAVA on the contributions towards AMR. I hope you agree. And harmonization among FAVA member veterinary association is strongly needed. You see the response rate to have representative views and the momentum of the efforts from FAVA on global AMR action plan. Yeah, thank you very much for your patience. Yeah, thank you very much for your participation.
Thank you. Thank you, Dr. Makita. I think he has very well, he has covered it very well, what the challenges of the FAVA strategic plan and the issues and so on. Yeah, so just it is here, the strategic plan. You can have a look, and that's why we keep looking at this document and seeing where we are having challenges and so on. The idea is to, like he has mentioned, to complement the role of the government in terms of trying to tackle this issue of AMR. So we're trying to assess, like Dr. Makita said, you're right, to the veterinarians, the veterinary associations, and trying to complement the efforts from the government, from our own efforts directly to the associations. So that's the whole thinking and idea of this strategic plan. And I think he has covered it well. So we know what are the shortcomings and shortfalls. So that will help us further improve our strategic plan in terms of implementing what we have said we're going to do in terms of tackling AMR. Please, any questions from the floor? Is there any questions? Yes, please, Dr. Joy.
Thank you. Thank you for that very useful overview. Maybe not a question, but just to flag that a number of the practical actions that could be done will be covered in this after the coffee break. So please stay put for that, because I think there are really a lot of things that veterinarians can do. So we're trying to make that easy, making that visible for everyone, and making that more accessible. So hopefully you can discuss this further. Thank you.
Thanks, Dr. Joy. Actually, please come back. There's something we want to talk about, the AMR pledge, and it's something important for the veterinarians. We will do it after the tea break. Now I'll call, thank you, Dr. Makita, for your talk, and I'd just like to invite Professor Acharya to give away some of a token of appreciation. Thank you. And, sorry, before that, after the session, we'll break for tea for 15 minutes and come back at about 3:45 for the second part of the antimicrobial session, the stream, right? So we'll talk more on this pledge and all this. We are moving on. Thanks.
Thank you very much, our chairperson, and also our invited speaker. For the first session, for the plenary, we have already finished with all the enriched information for the AMR. we are for FAWA, we are really appreciate your kind contribution. And at this moment, I would like to invite our president, FAWA president, Dr. Isao Kurauji, on stage to present the certificate of the appreciation to our invited plenary session. Thank you very much, Dr. Isao Kurauji. May I invite our first speaker, Professor Dr. Kwasa Nisam Madin bin Hassan Nisam. Yes. Yeah. Present for the certificate. Yes, thank you. Thank you very much. Thank you very much, Dr. Kwasa. Yes, next, I would like to invite Dr. Rohaya Binti Mod Ali. Thank you very much. And our very active speaker, Dr. Kohei Makita, our chair of the Standing Committee for our Antimicrobial Stewardship. Thank you very much. Yes, after this, could you please kindly stand by on the stage just for a photo session. May I invite all the speakers have a group photo with our president. Is it okay for closing the LCD? Is this okay? Yes, thank you. I would like to invite Dr. Joy and also our FAWA Executive Board. So we will end up this session. Yes, we will have around 15 minutes break, right? We will have 15-minute break, and then after that we will come back with the panel discussion and the way forward with FAO Dr. Mary Joy Gononsilo and our invited speaker, Dr. Brian Rabos. Yes, relax a little bit. Thank you very much.
You want me to go ahead and speak? Easy, are you able to hear me?
Hi, Dr. Brian, can you hear me?
Yes, Joy, can you hear me?
Yes, we can hear you from here now. Okay, so
Okay, and are you able to see my screen as well?
yes,
Okay, perfect.
in 5 minutes, I think we'll start. Do we need to test the screen? Because I think, because I think they're also live on Facebook, so they are managing also that it's in terms of visibility. So,
Joy, are you talking to me?
yes, Dr. Brian.
I get a lot of I hear the background music, the pause music.
Yeah, it's still coffee break here. You can
Okay.
hear the background music, but
Yep.
I think they will be coming back in a few minutes.
Okay.
Yeah, I think they will be off. Yeah, they've turned it off. Yeah.
Okay.
Hello, good afternoon, everyone. We will resume the seminar in a minute. Please come back to the seminar room. Dr. Lubers, just wait for a while.
No problem.
We are requesting our audience to come back to the seminar room. Wait, I'll call them again. Hello again, everyone. Good afternoon. Me and Dr. Bangbang here will continue our seminar for this afternoon. So to continue our session, Empowering Veterinarians in Facing AMR Challenges in Asia. Earlier, we heard the topic presented by our FABA President, Dr. Kwasa, Challenges and the FABA Initiative to Tackle AMR in Asia Pacific. And then afterwards, there's Dr. Rohaya Bintimot, who discussed tackling antimicrobial resistance in food-producing animal in Malaysia. And the third speaker discussed the current situation, the AMR and current situation of members by Dr. Kohei Makita. And moving on to our next talk of the afternoon, we'll have here a well-renowned speaker. He earned his Bachelor of General Studies from the University of Kansas and finished his Doctor of Veterinary Medicine and PhD at the Kansas State University, where he is now teaching. Currently, he handles classes on clinical pharmacology and food animal medicine for third-year students, pharmacology for second-year students, and diagnostic medicine clinical microbiology for fourth-year students. His expertise focuses on veterinary antimicrobial stewardship and therapy, antimicrobial resistance, and on the application of antimicrobial susceptibility testing in food animals, very fitting to our topic today. So friends, let us all welcome virtually Dr. Brian Lubers, veterinarian, and on his topic, Examples and Lessons Learned. Let us welcome on screen Dr. Brian Lubers. Dr. Brian, can you see us?
Yes. Yes. Can you hear me okay?
Yes, we can hear you.
Excellent. Thank you. Thank you very much for the invitation to present today. I'm going to talk about antimicrobial use decisions, and this was a survey that we completed. This is unpublished data, really asking food animal veterinarians what factors they considered when they used an antimicrobial or decided which antimicrobial to use. And then we also asked specific questions about stewardship guidelines. And so that'll kind of be the end of the presentation, but kind of what I think is pertinent to this audience. This is there we go. My presentation is very data heavy. And so I thought I'd put the summary up front so you can look for these things as we go through that data. And I don't know that any of these things are earth-shattering conclusions. I think these are probably all things that we would have guessed that veterinarians would have said about antimicrobial use decisions and stewardship guidelines, but I think it just kind of cements some of those things with actual data. And I think, again, pertinent to this audience and kind of supporting what some of the earlier speakers said about stewardship guidelines, they really, to be effective, they really require much beyond just the writing of them. And so our experience has been that if you want veterinarians to adopt those guidelines, they have to provide practical guidance to them, and you have to have really effective awareness campaigns. And I'll show you where these conclusions come from our survey. So this was a survey we conducted. Again, it was a research team from Kansas State University, Iowa State University, and the University of Minnesota. So those universities have expertise in cattle production and swine and poultry production. So we really wanted to cover as broadly the food animal species groups as we could. And our survey was distributed through the veterinary interest species groups for food animals. So that would be the American Association of Bovine Practitioners for cattle, swine practitioners, feedlot consultant veterinarians, and then we also had small ruminant and poultry groups that were represented in our survey. We asked a kind of a typical survey, so we did ask some demographic data. we asked about factors that were specific that veterinarians did or did not consider when they decided to use an antimicrobial. We asked veterinarians about their use of antimicrobial susceptibility testing. We asked them about their confidence in knowledge related to different aspects of antimicrobial use in food animals. We asked them some questions about what their level of concern related to antimicrobial resistance was. And then again, we asked them about their awareness and perception of these antimicrobial stewardship guidelines that we have published here in the U.S. So this is what I'm going to show you today. And again, it's very data heavy. I'm happy to, if someone in the audience would holler out, if you want me to stop and explain something further as I go, I'm happy to take those questions along the way. Just from the demographic data, so we did have almost 400 veterinarians complete our survey, so we felt that was pretty good. Our survey was conducted over about a 2-month period in the summer of 2021. Most of the respondents to our survey were private practitioners that were primarily but not exclusively food animals. So just a little, not quite half of our producers fit into that category. And then we had a mix of private general practice, so they would see all species, companion animal, equine, food animal. We did have some respondents that were specifically employed as a staff veterinarian within a specific food animal production system. Most of those respondents would be from either the poultry or the swine industries. We had a few academic veterinarians respond to our survey, and then we had just a small percentage of our respondents were private practitioners, but we say food animal consultant. That was the category. Those practitioners would be almost exclusively food animal. And then we had and a small percentage of other. We had a nice distribution across practice experiences. So almost a fifth of our respondents were more than 30 years from the time of the survey out of veterinary school. And then almost equal percentages in that 20 to 10 years, 20 to 10, or 30 to 20, 20 to 10, and then less than 5 years out of school. So a nice distribution of ages of practice experience. So our first question was about what are the things that you consider, what are the inputs that you would consider when making an antimicrobial use decision? And again, I don't know that this was a surprise to us, but it really cemented for us the things that are really important to practicing veterinarians are efficacy and safety, obviously, any sort of regulatory concerns that they might have or prohibitions against specific uses would play into those antimicrobial use decisions. And then the practical application of the regimen. And the way we kind of rephrase that when we talk about this data is, can I get that drug into the animal? So if we're treating large groups of animals in an outbreak, that's individual animal administration is probably not going to be practical. And so being able to administer drugs through the feed to those populations is how that's going to. So those are the top, if you split efficacy and safety apart, so efficacy, safety, regulatory, and then that practical application of the regimen, those are really the top 4 considerations. And by quite a wide margin, you can see cost does play a role. The potential to select for resistance does play a role. And then importance to human medicine, potential to select for AMR and human pathogens, and client preferences other than cost. Those were more minor considerations. But we're considered by a fair number of veterinarians. So I think what this data reminds us is that antimicrobial use decision is very complex, and it is best made by the veterinarian with boots on the ground that has knowledge of that situation and production system. So we did ask veterinarians about their use of antimicrobial susceptibility testing, and I am just rotating off my term as chair of the Veterinary Antimicrobial Susceptibility Testing Subcommittee for CLSI. So I will have to say I'm just slightly disappointed with these results, but I also understand why these results came out this way. So we asked veterinarians to what extent they use antimicrobial susceptibility testing before They prescribe antimicrobial treatments, and you can see that almost a fourth of them never do that. I can certainly expand on the reasons why I think that is if you'd like, but what we do see, though, is more veterinarians use susceptibility testing after they've encountered a problem or they perceive a lack of efficacy. So they're using it as a tool I'm going to paraphrase. They're using it as a tool to investigate the potential for antimicrobial resistance in that particular situation, which I think is kind of the place where antimicrobial susceptibility testing has commonly been kind of sold as a diagnostic tool. And so that was for all respondents. We kind of expected it would be different for those veterinarians. So these are all veterinarians except the veterinarians that are employed specifically by a production system. So this is kind of the general practitioners, the consultants that would fit into this second box here. And so we asked them, how often do they use susceptibility testing to routinely monitor resistance in veterinary target pathogens, so that the pathogens that cause disease in our animal species, and almost half said never, which again, I don't know that's a huge surprise to us, but it certainly cements that we have some room to improve and probably think about ways where we can position susceptibility testing as an AMR mitigation test. We asked the same veterinarians, do they routinely monitor AMR and potential foodborne pathogens? And the vast majority of them said never. I will say that number is probably a little bit high because in North America, at least in the US and in Canada, they have a separate system, but we have a government surveillance program for AMR foodborne pathogens. And so it's a national program. So I think most veterinarians would say that the national program provides better surveillance from a big picture level than what they would do as individuals. And when we ask those same questions of owners and staff veterinarians, we do see a little bit different. So owners and staff veterinarians, so veterinarians that are employed specifically by a production system, they use AMR to monitor in veterinary pathogens less frequently. But they use AMR to monitor potential foodborne pathogens more frequently than the general practitioners. I suspect that probably has to do with, again, those owners and staff veterinarians are primarily going to be employed by swine and poultry production systems. They probably have greater concerns about the brand. And so monitoring AMR and foodborne pathogens may be a brand protection tool, whereas they also have access to better production outcome data, health outcome data, which is probably why they're using AMR in the veterinary to monitor AMR and veterinary target pathogens less frequently, because they probably have a better picture of what's going on for health outcomes in that particular system. We asked them about their degree of confidence in different aspects of antimicrobial knowledge in general. And many of the practitioners said that they were very confident or confident in what they expected for therapy outcomes for common infectious diseases. We got roughly the same responses for the comparative efficacy of different antimicrobials, so antimicrobial A versus antimicrobial B, and what they would expect. They felt like they had a good handle on the basics of spectrum of activity. They also felt like they had a good handle on the duration of antimicrobial therapy, what was needed. I would argue that a little bit. I think that's probably an area where we need to focus some research to really bolster what we think we know about that. But again, our respondent said that they were pretty comfortable with the durations of therapy that they were prescribing. They expressed a little bit less confidence in the effects of ancillary therapies such as nonsteroidals or steroid drugs. And in the US, we have a concept called the post-treatment interval so we have a lot of single injection antimicrobials. And what we often do is we prescribe a post-treatment interval where an animal would not be eligible for therapy during that period. And there's some good evidence that supports that if we do wait and give the antimicrobial time to work, that's a good practice, and it cuts down on our number of retreatments and subsequent antimicrobial exposures, actually improves our health outcomes. And so the response to the degree of confidence there was, again, kind of middle of the road. And then the areas where our respondents expressed less confidence in what they knew about antimicrobials were susceptibility testing, the potential for resistant selection, and the use of combination therapies and how that would affect outcomes. We asked our respondents about what their level of concern with antimicrobial resistance, and again, this is really about AMR for the target pathogens or livestock diseases, and what's their level of concern with AMR for the potential foodborne or zoonotic bacterial diseases in humans. And kind of as we would expect, and this is not, I don't think this is unique to antimicrobial use decisions, is the farther we are removed from the consequences of an action, the less concerned we are. And so our practitioners were much more concerned about AMR in livestock disease pathogens, and really I think that relates back to one of their primary considerations in using or choosing an antimicrobial is efficacy. And so if they feel that AMR is reducing efficacy, of course that is a concern to them, whereas they're multiple steps removed from the impact in humans, that's a harder behavioral aspect to overcome. And so we saw less concern with that. So what I'd say all that just to kind of give you some background and maybe a little bit of a feel for what antimicrobial use in North America looks like. And this is what I really wanted to talk about, which is the kind of the awareness and perceptions of antimicrobial stewardship guidelines. So we used, there are 7 kind of antimicrobial stewardship guideline documents that we have that would apply to these species group. We have the AVMA, which is the American Veterinary Medical Association. So that would be a broad professional level stewardship guidance document. And there's 2. One is kind of the checklist of things that veterinary practitioners can do. And then there's our stewardship definition and core principles. So those should be overarching across all species groups. I'll come back to why that may be a little less effective. And then we had, again, the bovine practitioners group, which is AABP, we had AABP AVC, which is veterinary consultants. That's our feedlot. So those numbers 3 and 4 would primarily apply to cattle. Number 5 is the swine practitioners, judicious therapy use, stewardship guideline document, small ruminants, and then the American Association of Avian Pathologists, our poultry group. And you can see most of these are relatively new or have been revised recently. And so that may also have an impact on what I'm going to show you next, which is the general awareness of these documents, because our survey was conducted in the summer of 2021. For example, numbers 5 and 6, the swine document and the small ruminant document, those had been out roughly about a year at the time of our survey, whereas some of the others had been out for 2 to 3 to 4 years. There we go. And so what we asked our survey respondents is, and this is the question verbatim from our survey, is indicate which of the following categories applies to their listed stewardship document. And we did put in there, we're not trying to display any disrespect for these documents or the organizations. We really just wanted to know what was the level of awareness, use, and utility in daily practice. And I want to kind of reemphasize that point again. I do think stewardship guideline documents are very important and they're useful, but there are some limitations to them, and we'll come back to that. So the options for, what was your, which category fit was a respondent was completely unaware of the document even existed. The respondent could be aware of it but hadn't read it. And then there were options of, I had read it, but they couldn't recall what was in the document. They had read it, but there was no practical guidance. They had read it. There's limited guidance, and then they had read it, and they felt like that was a practical document for them. And so what we did, we asked the survey respondents about all 7 documents, but we split them out as into we had all respondents that were reporting that species in their practice. So for the bovine stewardship guideline documents, any respondent that reported that they serviced cattle, we would summarize them. And then we split out which of our respondents were actually members of that organization. And our expectation is that if you were a member of the organization that had produced and published the document, you should have a greater awareness of that. And so this is kind of the start of that. So this is what our data looks like. So for the AVMA principles document, 19 and all of our respondents, that should have applied to them because, again, that's our broad professional organization that represents all veterinarians in all species. 20% of our respondents were not even aware that that document existed, at least the principles document. Even more were unaware that the checklist existed. And as I said, we expected that if you were a member of that organization, your awareness would be greater. But what you can see from that unaware column comparing each between all and then the member specific, there is greater awareness, but it's not greatly significant. And so I think this is a good lesson for us that as overarching organizations that are producing guideline documents, there is a lot of room for improvement just in raising awareness. So you can see in our survey, except for the the swine veterinarians, AASV members, and the AAP members, which are very small groups, generally the unawareness of even the existence of these document ranged from about 20 to 50 to 60%. So we have a lot of room to get better there. Then the next step would be that a respondent was aware of a document but hadn't even read it. So again, I think some of the previous speakers mentioned effective awareness campaigns. It's not just that they exist. I think there needs to be, as guidelines are produced and published, there needs to be some informational and kind of some how to use the documents. And maybe that's through webinars or websites or trainings. But then the other part of our survey was we asked for the respondents that said they had read it, what was the level of effectiveness? And thankfully, very few respondents felt like any of these documents provided no practical guidance. So less than 5% for any one document said that it wasn't practical at all, which is good because a lot of these individual respondents would have had a say somewhere. Because these are organizationally developed documents, they should have had a comment period or an opportunity to say whether something was practical or not. One of the things I wanted to point out was that the highest responses as far as providing real practical guidance, so the far right column, were amongst the swine and the poultry veterinarians. And I have on my next slide, I have reasons why I think that is. But first of all, the number of survey respondents from those two groups was low. They're smaller groups by nature anyway. But secondly, those groups, there's more vertical integration in the poultry and swine production systems in the U.S. There's more homogeneity of different production systems. So a swine farm in Kansas probably is going to look very similar to a swine farm anywhere else in the United States. When you get into, especially the cattle, we see wide variations in the types of systems that are used, from very small operations to very large operations. And again, with cattle, we see we have in the U.S. we have three kind of sectors. We have the cow-calf sector, which is where the reproduction and calves are born, and then we have an intermediate section which we call stockers, which is kind of preparation to more intensive feedlot. And so those three steps, producing one document that could practically apply across all of those systems and all of those size systems is very, very difficult. And so what you have is you end up, when you write these stewardship guideline documents, you try to achieve this balance between they need to be practical and they need to have some specific guidance in them. However, it can't be so specific that it doesn't apply as universally as possible. And that I think is the challenge, and probably explains some of the reasons why the different sector groups had different responses as far as the level of practical guidance. So again, in kind of summary for my presentation and things that I think we can pull out of our survey that might be useful to this group, is they talk about awareness campaigns and stewardship guideline documents. Again, most of our respondents had very little awareness of the documents or had very superficial understanding of what was in them. And so I think really those effective awareness campaigns would be a good first step. Again, very few respondents felt that the stewardship guidelines didn't apply at all to them. And again, our species-specific groups, I just mentioned, the swine and the poultry, because of the type of systems that they work in, writing guidelines that can provide more specific, which I think equates to more practical guidance in terms of our survey, is much easier to do. And so I think as we continue to develop stewardship guideline documents, we have to have these things in mind, that what the stewardship guideline document for swine looks like, not just because the production system is different, but because the types of production systems are different, we can't take that document and just change the word swine to cattle and end up with something that would be useful. It really needs to be tailored to the specific needs and the specific stewardship needs of that professional system or that species type or that industry. So that's what I have, and I am happy to take questions now, or I am planning to stay around for the open session if somebody would like to have questions then.
Is there any questions from the floor? So in the meantime, thank you very much, Dr. Labers, for being part of this meaningful event.
Of course, thank you.
Okay. Thank you, Dr. Brian Lubers. So we are going to the next presenter. I would like to introduce the presenter. Dr. Mary Joy Gordon-Silo is the AMR Regional Project Coordinator at the Emergency Center for Transboundary Animal Disease Operation, or ICTAD, of the Food and Agriculture Organization, FAO, Regional Office for Asia and the Pacific. Part of her work has been on developing tools, strategies, and innovative solutions to mitigate antimicrobial resistance in the food and agriculture sector in Asia. Prior to joining the FAO, she served as the Science and One Health Coordinator of the World Organization for Animal Health, WOHC, founded as OIA, Sub-Regional Representation for Southeast Asia, and as an assistant professor at the College of Veterinary Medicine, University of the Philippines. She holds a Doctor of Veterinary Medicine degree from the University of the Philippines, Master of Tropical Veterinary Science from James Cook University in Australia, and a PhD from Michigan State University, USA, where she specialized in antimicrobial resistance, or AMR, in livestock animals. So I would like to, with honor, to invite Dr. Joy to present the.
Thank you, Dr. Bambang. Thank you, Dr. Cora. May I have the clicker? Thank you and good afternoon, everyone. So this afternoon, I'll be talking about some approaches that we are taking. I think Dr. Makita earlier highlighted what we need to do and what we can contribute as veterinarians in the region. So these are just some examples that we are starting to initiate, which we hope we can have your support as well. Where do I point this? Hello. Okay, this one. Okay. Just to emphasize, first things first, the impact of antimicrobial resistance is not unique to Asia. It's global. And as you can see here, anywhere in the world, it is an issue. But maybe one thing of note is that in Asia, okay. In Asia, it's where it is most pronounced. I think in this morning, Dr. Kashan has heavily emphasized the factors that affect and impact, our region. And I guess this is where all of us can take a role and take a concern. Okay. So that's the global picture. But then let's take a look. This is not meant to be readable. This is the current situation in terms of we collected information from different countries in the region. And what I'd like to emphasize, just look at the color coding. In terms of red, think of traffic light, where red is problem. Green is not really a problem, but it's there. Yeah, maybe maybe I'll just say click. Yeah. So here you can see the differences with the highest priority critically important antimicrobials in humans was the first one. And then the second one was the high priority critically important antimicrobials. So I guess I'll just click away. What you can see is that there's more red in antimicrobials that are rather old and more specific to animals. We still have a way. There's a room for us to improve further, but as you can see, and this is only from healthy animals and specific to Salmonella in poultry. In swine, it's almost a similar picture where you can see the segregation, where the high priority critically antimicrobial and highest priority critically important antimicrobials, we have problems, but they're still like, it's worse when we go to antimicrobials that are rather old and has been there for a long time. What is noticeable also here is that different countries have different issues that we need to resolve, but there are also things that we noted, like the differences in techniques, the lack of harmonization, and some errors in methodologies. So I guess this is where we would like to emphasize. We need to do something, and we need to do some things correctly. So I guess when we talk about combating AMR, it's very anticlimactic, no? Yeah, maybe next. Okay. So I think as we all understand, AMR in bacterial organism does not recognize biological, physical, or sectoral boundaries. So the problem in animals could be a problem in human health and vice versa. Its potential transmission pathways include broad areas of discipline that are often traditionally segregated: agriculture, humans, environment, and wildlife. And this is why it is important to take this with the One Health lens. Next, please. So it's rather complicated, as you can see here, the agriculture with the human sector, food, there's environment, there's wildlife. Next, please. maybe back. Oh, but anyway, just to show you that that emphasizes the need for us to work together, but be good at where we're supposed to be good at. Veterinarians need to focus on the things that will be our that is our specialty, area of specialty. We cannot be experts on the problems of humans, but we can contribute, and vice versa. So I guess here is where our expertise as veterinary professionals can contribute. What can we do? Our inherent areas of expertise actually contribute to a lot of things globally. So with our inputs, we contribute to healthier animals, healthier people, better economies, better communities, and better society in general. AMR is no different. In AMR, what we can do is that having the proper practices, and we will go through this later. Next slide, please. So this is where the work is beginning on how we are combating AMR with a One Health approach through a veterinary perspective. So focusing on this, the Food and Agriculture Organization developed an FAO action plan from which the FAVA AMR strategy was kind of shaped from. It covers all these 5 pillars of work, as has been emphasized: awareness, surveillance, good practices, responsible use, and governance. Let me just emphasize a bit more on the 2 areas on good practices and responsible use for this particular period, because we'd like to emphasize on the practices and prudent use that could be improved as veterinarians. Next slide, please. Now, it is essential that we now move beyond just discussing the AMR problem and focus on implementing solutions. This calls for our daily decisions that we need to make on antimicrobial stewardship as veterinarians. Do I give? Do I not give? Which drug do I use? But then it's not as straightforward as that. We hope that if there's a guidance, we follow and everything is good. Next slide, please. We understand that there are more issues than this. For example, we are exposed to a lot of incorrect information. There are brochures that are colorful, that are nice, that are very informative, but sometimes they are not correct. There are also no clear return on investments. We cannot be driven, our industry cannot be driven or by public health messages only. I guess when we say, oh, this is good for humans, but what is in it for the production side? It's impossible to maintain the same way that we operate if we are expecting something that's good. So we need to understand those drivers. We also have client expectations. We want income, you use this because it's this, so there are also client expectations. There's lack of leadership. There are client preferences. Sometimes they decide for us what to use. There are lack of governance structures. There are lack of diagnostics in the field. How can we treat? What's our first action? Just give anything that will address the problem. It's also an issue that it's very cheap. So if you give it, it felt like you did something. But then that's not really the solution. When we go back further, there's also lack of antimicrobial stewardship in the existing veterinary curriculum. And there are lack of independent guidelines for antimicrobial use. So I guess these are just some of the issues that we are plagued with as veterinarians. So how do we address this with, realistic expectations? I guess what we could do for now, next slide, please. We can only do so much. So enhance motivation of veterinarians through professional incentives, community inspiration, social drivers, and present economic case. We also need to enhance abilities. I mentioned earlier that, okay, it's good to do, let's make them inspired, but we need to do things correctly. Let's do it, but let's do it correctly. So we need more information. We need to equip veterinarians with the correct information. It's not for the lack of training. We are trained as veterinarians, we know. But things are evolving over time. So they need to have access to the right information to help them make good decisions. So they have to have access to guidance, access to resources, continuing education, and curriculum inclusion. And aside from that, we need to create a reinforcing environment such as community support, leadership, public awareness, and regulations to make this possible. In short, although we are plagued with a lot of issues, this is not something we cannot just solve overnight. At least there are things that we could do, but how do we prioritize? Next slide, please. Another click. I think there's so many options that we can do, but let's focus on areas that are desirable. I want to do this. That is doable. I can do this. And that's sustainable. I will keep doing this. Because at the heart of this convergence, and that would have been nice with the, but it's very, click please, is where change can begin, where this convergence begins. So this is the focus of the work that we have been working with FAVA in the last few years. So we have been just raising awareness, but now I think it's time to do something. And I think the work, it's time for action. And so let me start by, would have been nice if I can click. Next slide, please. Okay, so let's first start with enhancing motivation. Next slide, please. So just some examples of the activities that are ongoing. Beside me here is the FAVA AMR pledge. And what is this? This is linked to the work of FAO on healthy farms and healthy futures. I'll mention this a little bit later. But this is just seeking commitments, professional hours from you, from veterinarians, to commit to community service. Something that's doable, nothing that's, nothing that you cannot deliver. So if it's 1 hour, let it be 1 hour. If it's 30 minutes, let it be 30 minutes. But if you're so inspired, maybe 8 hours or something, or 1 day or 2 days that you could devote to your National Veterinary Association to be a resource, to reach out to those people who need your information and your services the most. So this is the AMR pledge, what the AMR pledge is about. But this will also try to harness maybe some incentives such as CPD points or social responsibility that will also benefit both ways. Because this is a way that we could gather this. Again, we will focus on doing this in a correct way, so the resources will be provided. So our messages will be harmonized and consistent. We cannot say something and then say another thing. If you're from a company and would like to promote something, we need to harmonize our messages so that the correct information reaches the target audience. So there will be a pool of resources for those who are committing that this can be yours. It can be a sample collection. It doesn't have to be seminars. It can be about teaching farmers how to dispose waste properly, how to dispose antimicrobials properly. It's depending. So it's kind of like trying to see what can you do. Just give what you can give, nothing more, nothing less. Next slide, please. So part of this, with the help of FAVA, the work is to also reflect this through social media campaign, so that when someone in the Philippines went out to collect samples, they can post it in social media, and someone from Indonesia can see, so this is what's happening. So there will be a cross-exchange of information just to also stimulate, what can be done. Next slide, please. As I mentioned, this is anchored on the Healthier Farms for Healthier Future, which is a broader umbrella of work that we are doing. This is not just for AMR, but we're starting with AMR. This can also be for biosecurity issues, for transboundary animal diseases, but we are taking the right approach, right? It's risk-based. We prioritize where areas are important. It's science-based, based on evidence. We are prioritizing, say, what antimicrobials we need to protect or what we need to prioritize. It's also inclusive, meaning people are involved, community is involved, youth, gender, women, men are involved. So it will be inclusive. Grounded and global, meaning it takes into account your experiences in the field, but is consistent with international standards. I mentioned on taking this approach about doing it correctly, doing things and doing it correctly. FAO has been developing a series of guidelines on antimicrobial surveillance, for example. This allows us to harmonize methodologies. One of the guidelines that will be released soon is for AMR surveillance in pathogens. This is important because unlike for public health importance, bacteria of public health importance, we are trying to protect the humans, which is a nice thing to do. But it's also nice to protect the animals that we signed up for. What are the antibiotics that you should use when there's respiratory infection in poultry? What are the antimicrobials that you should avoid? Because you know, in mastitis cases, 90% it's already not useful. So I guess this is focusing or centering on international standards and international or available information in the region. So we are harmonizing, trying to harmonize this. Holistic because it leverages on multidisciplinary and multi-expertise. It's also consultative and taking on a One Health approach, meaning as much as it is important for veterinarians to take actions, we also have our economists. We also have health sector in mind. We also have other sectors and other expertise in mind. We have the comm specialists to do this, to work on this. And lastly, it should be transformative. We should be moving forward where we are starting. So that's just the concept for healthier farms and healthier futures. It's involving different sectors, different target audience through channels. Like, for example, we're taking this example for AMR, but in the future, there will also be for transboundary animal diseases, for biosecurity in general. And for this initiative that we are having, FAVA is taking the lead on having the FAVA AMR pledge. Next slide, please. Now, we don't stop in just enhancing motivation or inspiring or engaging people. We also need to enhance abilities. And by enhancing abilities, it's not just being experts or that it doesn't imply that we lack the ability, but we need to make it simple for the experts. For veterinarians, let's make it simple because there's so much information available now. How do we simplify and enhance these abilities? Next slide, please. So FAO, again, also with support from anyone, and you can contribute to this, we're building an AMR tackle box, meaning all guidelines, all materials that could be important for biosecurity, for infection prevention and control, for prudent use, and this will be curated, and we'll put this together in one packet that will be accessible to all veterinarians, meaning there will be a one-stop shop for those who will need interventions the most. We will also put together educational package, at least access to those if it's needed, so that you have this AMR tackle box. And it will be accessible to veterinarians that are willing to sign up and willing to do it simply. So it will simplify the efforts if you only just would need to want to do this. And next slide, please. At the same time, we're also building a virtual repository of materials for developing national treatment guidelines. Dr. Brian Lobbers talked about the importance of stewardship guidelines. Many countries are also now starting developing national treatment guidelines, but based on empirical information. But I think eventually we will be evolving for this to be influenced, to be evidence-based on the data, based on the data from AMR surveillance. So how to develop national treatment guidelines. We are setting some examples. This is already actually existing, but we would like it to be more accessible and more creative. So we are setting up a web page where you can access this if needed. And next, please. Okay, we're also featuring, there has been so many initiatives around the region that has been shown to be successful. But at the end of an initiative, at the end of a thesis, at the end of a project, they get forgotten. So what we're trying to do is document all those initiatives that have been shown to work in the region. If it's for biosecurity, it's also relevant for AMR because that means you don't need to use antimicrobials. If it's a prudent use initiative, we'll put it here. So I guess one important contribution that you can do is to flag. Please add our initiative here. It has been successful. We want it immortalized. In a way, it's a repository of things that have been shown to work and that could be accessed by others. So we don't have to reinvent the wheel. Some examples have been, in Indonesia, they've been applying 3-zone biosecurity. It's very simple. Farm is color-coded. You cannot wear color-coded slippers across a different color zone. It's very simple. It prevents transmission of diseases. So it's not just preventing AMR, but also preventing other infections, which will help also the producers because that's good for them. Yeah. So we're collecting all this. So if you are aware of any interventions, even alternatives that have been shown to work, please do let us know so we can allow us to review and put that in the repository so it will be accessible to those who are looking for solutions. And so we don't have to reinvent the wheel, but make it available for others. So I guess that's one way. Next slide, please. Later on, you will hear about more about this. So we're also setting up a technical working group. FAVA is setting up a technical working group we're starting with swine respiratory infection. Why? Because in the 2021 survey of FAVA, it was shown that certain bacterial infections in swine affect the use of antimicrobials, which is a problem. And I guess because swine is an important commodity in the region, we'll start with that. But eventually, we will go to also poultry, mastitis, and other diseases that have been shown to be a problematic area where abuse of antimicrobials are noted. So we're starting with this, and I don't want to preempt. We will hear more about this, but this is already something that is being started. I think as of today, we have sent the signature. So that's starting. Next slide, please. And Dr. Brian Lubbers, who is the expert, I hope he's still here. He's CLSI expert that sets clinical breakpoints for animals, for animal pathogens. He will be in Asia for a technical advisory group meeting. So taking that opportunity, we thought, maybe, we could arrange missions for him in countries where he can talk about, what's the importance of antimicrobial susceptibility testing? What can we do? How can vets be involved in sample collection and transport? Because that's a problem, no? When you find cases, the first thing that people do, dump antimicrobials. So what we're trying to influence is that when you see case, please collect sample, send to the lab so people in the lab can find out. At the same time, laboratories, private labs can also share information because this is critical for building information on resistance that are occurring in pathogens, and in those pathogens that concern us and concern production. So by doing this, veterinarians, and this can be linked to your pledge. If you're doing this can be linked to your pledge as well. So we are doing something that is globally important. So I think that's something, no? Because also, by the way, majority of the resistance reports that you see are based on human clinical breakpoints. This means it's meaningful for humans. It's well and good. It's our role also as veterinarians to protect people. But how about the animals? They require clinical breakpoints also for us to be able to determine whether drugs are effective or not. But we do not have enough information. There are very few antimicrobial clinical breakpoints for animals, particularly for aquaculture. So this is the work that we're trying to mobilize. How do you harness a whole region contributing to this pool information that can contribute to the global pool of data, that can contribute to us finding ways to determine and to advise others on what will still work and not work. So we're starting this now. Aquaculture is also starting. We're not even dreaming of clinical breakpoints, that epidemiologic cutoff values or epidemiological breakpoints would be important. So that's a huge work ahead of us, but there's some room for your contributions. And next slide, please. I think this will be some of the last few slides that I have. So how do we enhance, create reinforcing environment? We have community of practice for national treatment guidelines. This is by nomination by the countries, by the way. We also have, next slide, please. Click, please. Community of practice on prudent antimicrobial use that you can be part of if you want to hear about what's going on, what's happening. Please sign up. Please sign up and join the community of practice, because as a region, it would be good to see also what others are doing. This will help us reinforce our actions, maybe recommendations from other people. Let's do this as a, as a collective action. Next slide, please. And of course, there are also other related initiatives on raising awareness, enhancing surveillance, improving practices, promoting prudent use, and enhancing governance, not only at your country level, but also at regional level, at the global level. These are all supporting towards this end. So your efforts are not a standalone effort. It's supported by this. And I think as a last slide, I just like to pin down the work that we are doing benefits animals because we reduce the need for antibiotic use. Animals will have, they're better because if antibiotics are not needed, then we can keep them healthy. If we keep them healthy, then they don't need antibiotics. And of course, it also improves animal welfare. You want the right treatment for your animals. Second, our efforts will also benefit farmers because with this, we reduce the cost of production, we improve farm productivity, we reduce the risk of other infections, including transboundary animal diseases. So our work will not be isolated and in silo just for AMR mitigation. The same methodologies for preventing transmission of disease, this will be the same that will prevent you from having ASF. This will be the same for having, preventing avian influenza and others. And of course, we improve livelihood. At the same time, we also public health benefit. For public health benefit, we have reduced the source of resistance genes. We reduce the opportunity for resistant strains to emerge, and we reduce spread of resistant infections. So these are also spillover of benefits if we work on this. And lastly, one slide, please. Yeah. Better ecosystems, because we reduce spillover of antimicrobial residues, we reduce environmental contamination, and we provide healthier microbial community overall. So the work that we do at the core is not only in the end for veterinary purposes. It spills over to other areas beyond us. And as FAO 4Betters emphasize, this leads to, one last click, please. Better production, better nutrition, better health, and better environment. Better environment overall. So I guess with this, hopefully, we make it easy for you. And if you're interested, please join us in this effort by pledging. So your details will be connected, and if there's anything that will be needed in this area, you will be part of the pool of people that could be tapped for work on AMR. So hopefully this inspires you to do something that is more than what is called for. But I guess collectively, this will be transformative as a region. So I think with that, I end my talk. Thank you, and one last clip to say thank you.
Before we close for this, Dr. Joy, is there any question? One? Oh, just one.
Sir, one thing I can supplement to Madam. Of course, there is misuse or there is demand of antibiotics, and at the same time also we are looking for biosecurity. But one thing we have to emphasize, that is nothing but use of alternate medicines.
Yes, yes.
That is specifically the medicinal plants, because there are a lot of phytochemicals which are antibacterial.
Certainly.
So these areas are to be taken up. Even also there in India, we are also taking up, there are a lot of phytochemicals, medicinal plants, because of our traditional knowledge, skill and belief of the people. We are taking up many plants to have the use for antibiotics,
Yes.
specifically the antimicrobial activity. So
Certainly.
those things can be taken up in many areas, many countries, so that there will be a burden of demand of antibiotics, specifically the antimicrobials, will be reduced, and we can take up.
Yes, certainly. That's one of the alternative solutions that's being considered, and that will be part. That should be part. One thing that I have to highlight, though, not because it's an alternative, it's better, or that not because it's from natural treatments. We have seen, you have seen extracts of plants with Pseudomonas, which is far worse than when you treat it, apply it. So I guess again, let's look at it from a science-based evidence. So let's not just blanket say that
Yes,
alternative.
that
So
is
we
correct.
need-
So we have to think of
Sure.
the constituents in the phytochemicals and how it will be
Yes.
really applicable, even also the antibiotic sensitivity tests.
Yes.
And also all these things also can be taken up.
Certainly.
And even also in India, the country has decided to have a National Ayurveda Day on
Yes.
November 10th. And we are mostly emphasizing on this antimicrobial resistance.
Yes, and we're counting on India to contribute to this pool of information.
Specifically, this area is very important. We are taking up.
Yes.
Thank you, madam.
Thank you very much.
Technically, that's not a question, Dr. Bangbang, but go ahead.
Yeah, please.
Yeah, my question would be to all the presenters. I thought they were all quite good, and I'd like to know if we have access to their notes or their presentations.
Sure. I think it will be available in Fava, but otherwise we're happy to email you the presentations.
I'm told it's of all of their presentations are available, so we would have access how?
Oh, hi, Dr. Leanne. All the presentations will be uploaded in our FABA AMS Facebook page, maybe tomorrow or the next day.
And plus also I mentioned there will be repositories of information, so please keep posted on when once it's available, we will share. So if you're interested to know more, you can join the WhatsApp link for people who are interested in prudent use. So this is the community of practice, and one function of this community is to exchange information on this, so it's accessible.
Sorry, my question is a bit difficult. But you know, we're already communicating with the medical doctors in the Philippines. Can we include those critical antibiotics that should be used in humans and not in animals when we discuss regarding this initiative, Dr. Goldensealer?
Yes, that's already part of the framework that we are working on, because of course what we need to protect is also those that are highest priority, critically important antimicrobials, to make sure that the work that we do impacts not only the animal health sector but also the human health sector. So in categorization, that's already in terms of priority.
Okay, thank you.
Yeah, thank you. Is a question from? Yeah, please. One question, please. No?
From Dr. Raul Bero? Is that a hand raised?
Yes, that's hand raised.
Okay. Hi, Dr. Bero.
Hi, Dr. Joy and all the presenters. Congratulations for well prepared materials. Just my thoughts from my end. I would like to say something about the presentations. Once again, needed actions for that is that, first of all, and depending on the country, we must also understand how many backyards, and this is in swine, how many backyards, how many commercial, who required, are the vets really required to do a prescription, or where are we now? Because we know the capability of the vets, the limitations, and we know that farmers also in real practice also buy antibiotics. So it should have been good if only the veterinarians that must do the prescription so we can control it. So that's a very important future or the short to medium term approach. Next is when we go farther to the farms, we have to, in commercial farms, vets or can be consultants or can be a farm vets that are important to really lead the way in doing the prescription. And since there are many commercial, smallhold or backyard farms in the Philippines, so it must be controlled by our partners in the feed industry, where there are a lot of vets there that must be given also the choices or the leadership to make that prescription, so they all know what to give, because antimicrobials, antibiotics are given in 3 different approaches. You know that in the feeds, you know that the injectables, and also in the water approach. So there's a lot of things why antibiotics cannot be controlled. Next is understanding what are the diseases that are common. We're talking about antimicrobial resistance, but for enteric problems, we know that there are many alternatives already ongoing. The essential oils, the organic acids, the butyric acids, they're working towards control of those enteric problems. But Clostridium can be different. So that's why, again, diagnostics and the Clostridium part is very important, which not many countries are having that diagnostic capability. So it always ends up in the diagnostics about the E. coli isolates. Next is also the laboratory must have also a capability to do the bacterial isolation. It must be expanded, and also the after that, the antimicrobial sensitivity test. So these are, again, another challenge that veterinarians need, because we cannot do the prudent use of antibiotics together if we don't have a proper isolation. Now, I appreciate the presentation of the survey of Dr. Brian a while ago, and saying that even in the States, there are few number or limited number of people who are doing also the research work on responding on those researches. So there's a lot of things, but I'm just mentioning those issues that I feel that we all need to really go to proceed into, but there are also limitations and challenges that we need to address first before applying it fully. Thank you, Dr. Joy, and thank you, Pava.
Thank you, Dr. Bero. I think there's really a lot of issues. Thank you for pointing a number of them, Dr. Bero. And it's not just that. I think the good news is that it's not only our problem. So we can share the problem. So there are already parallel initiatives happening in this specific areas. So I think maybe what we can do is work on what's workable, and then do so that we can move forward. I guess these are areas that are already being cared for, So I guess this is important to have cross communication also between disciplines, because there are initiatives happening in this area, in this area, in this area. There's a lot of problem, and I think this is just the tip of the iceberg. But I think somehow we doing little as the motto for the FABA AMR pledge: small steps, big impact. So I think what are the small steps we can take today? I guess that's the good news about this. And I think that already gives a segue for the next session, I believe.
Okay, thank you, Dr. Joy. Please, big applause to Dr. Joy for the very nice presentation. And now we are going to the next session, or a panel discussion, and I would like to deliver to our moderator. Please, Dr. Corazon.
Thank you, Dr. Bambang. Thanks again, Doc Joy, on discussing innovative approaches to empowering veterinarians in facing antimicrobial challenges in Asia. So to lead our panel discussions on the development of regional guidelines for prevention and control in swine priority diseases in Asia, help me welcome back to the spotlight Dr. Mary Joy Gordoncillo, and she will be joined by, nonetheless, Dr. Eugene Mende, co-chair of the PABA Antimicrobial Stewardship Subcommittee. And Dr. Eugene Mende have been very actively participated in the past 2 years on our PABA, FAO, AMR seminars, webinars as a speaker and moderators. And now, panelists with Dr. Joy. Thank you.
We have also online some of the members of the technical working group, right? Yeah, okay.
Thank you. Yes. Good afternoon for our online participant. You are our forward technical group, right? And we have one is from Thailand, Dr. Meta Mekhanon. Yes, good afternoon, Dr. Mehta. Thank you for your kind participation. And also the other one is the Professor Dr. Rungro Thanawongnuvet from Chulalongkorn University, expert for the swine disease. Good afternoon, Dr. Rungro. He's also with us. And also the other one is from Dr. Rajesh Kaurhari Dari. He's from Nepal. We have three right now together with us, and we get apology from the other one. He has already occupied with the others, but of course I think that they are really try to participate with us. And also Dr. Mende, our technical group. Yeah, you are on site. Yes, and Dr. from Philippines, right? Yes. Thank you very much for your kind participation. So we will start for the panel discussion. Yes, please, Joy.
Maybe I can start with the idea. Good afternoon, everyone in the virtual audience. I think we'll start from the input of Dr. Quaza. This is about PRDC. And truly, in his data says the most common infections in poultry, swine, and cattle are respiratory diseases like for swine, enzootic pneumonia and APP. For poultry, that's coryza and CRD. These are all respiratory diseases. And for cattle, Pasteurella. But the other data says the most common antibiotic used are amoxicillin, enrofloxacin, and tetracycline. The conflict here is all these three are medically important antimicrobials and broad spectrum, which is against our prudent use guidelines. So I think my question is, this highlights the importance of veterinary therapeutic guidelines. Where should we start? I think that's the question. That's a conflict in here that we are facing as practitioners. The antibiotics we are using are not the ideal medications that we should be using. What is your take on this?
And maybe just to complement that, when I showed you the collective data from different countries, what you will also see is that there is a problem on resistance rates in fluoroquinolones, enrofloxacin, penicillins, ampicillin, and tetracycline. So I guess that also reflects the resistance patterns that we see in animals, the usage. Yeah, so I guess that over.
Yeah. Anything from any input from our panel in the virtual audience? Okay, I think this highlights really the need of a veteran therapeutic guideline. I think Doc Joy in her closing speech, she called this the how do you call it, the developing the abilities. And I think that should be a good start. We should develop evidence-based and science-based programs. Humans, if I would like to share this, in the Philippines, humans, they develop medications, top 3 recommendation for every disease. And if you are using antimicrobials that are not in the top 3 recommendations, the insurance will not refund it. And so that's a good way, developing the guidelines of which to use, what to use, based on the infection, and do systems that will promote that program. And I think that is narrated by Doc Joy in her presentation. And that is one of my recommendations. Dr. Quasa?
Yeah, I just like to give some inputs on this. I think various speakers have mentioned about this, about antibiotic sensitivity tests, AST, and bacterial isolation. I think that would be key. And I think Dr. Joyce mentioned, can we take samples and try and do the isolation and look at the sensitivity and then start the treatment regime. So that kind of thinking has to set into our practitioners, how can we move towards that? Because like I showed the pie chart just now, at least more than 50% are still just administrating antimicrobials as they're used to, based on what is available or maybe the cost and so on, and which is purely not giving the right outcome, right? So I think that area of trying to send samples for bacterial isolation and AST will be very helpful in trying to look at what's happening at the animal level, and then trying to use more narrow spectrum kind of antimicrobials, and that would help, at least in that what we are trying to achieve at this moment. Thanks.
Thank you. I have a question for Dr. Makita. You have mentioned in the summary for your PABA strategic plan to continue our initiative that in SP3, there is a demand of the provision of information and training on hygiene management from us. And you are recommending a potential opportunities for training trainers of local vets and students. So I just want to ask if you had plans on your mind moving forward.
Thank you very much. Again, because I'm very new to this world, it may be difficult to say concrete. But for example, in Japan, we have a hygiene guideline for all livestock farmers, which is applicable and accessible to any farmers. They are listed on the website. So toolbox, what?
AMR Toolbox.
AMR Toolbox.
Yes, welcome to bring that in.
Yeah. The thing is that, so if we consider, like a farmer, it considers something developed brand new. It's challenge, but by the collaboration of the two books, they're finding
future project.
Yes, already existing handouts from some member countries, translates and put in the toolbox, then using Facebook. Well, something that coordination can work, I think.
Yes, so establishing the link between project. Thank you very much, Dr. Joy, for the really innovative initiatives.
Yeah. Maybe also just to step a little bit back on this TWG, no? One of the initiatives that we will have now with FAVA is setting up this technical working group for starting with swine respiratory infections. Because we see also that the nature of the problem, you don't go to the field thinking about AMR. You go to the field thinking about diseases. But this thinking, I think having a guideline for how to manage common infections will help us reduce the need for antimicrobials. And in a way, this will impact also the need for use. And so one of the initiatives that FAVA is starting now is setting up this small group of experts on swine infections, where they will be developing maybe a simplified guideline. So I guess the audience can also propose what you would like reflected in this guideline, just to make sure it caters to the need of people in the field and that it will be useful for vets as part of the toolbox kits. So I guess this is one way of putting it.
That was a very good input. Now we go to the field not thinking about AMR, but we think about the diseases. So I'd like to raise this question to Dr. Rohia, because you recommended in your program to eliminate prophylactic use of medication. I understand feed grade, how do you call it? Food promotant, growth promotants are not good, but prophylactic are beyond minimum inhibitory concentration. And in the practice, two will be hit. One is in our day-old chicks, in brooding chicks, there has been studies that prophylactic use is very valuable in the growth of broilers, and also in weaning pigs. You know, when you expose piglets to movement, prophylactic use would be of help. How do you reconcile, for practitioners, this is very important for their disease control, this is beyond MIC, but recommending to take it away?
I think for the prophylactic, actually there is two opinion. Actually, the industry need the prophylactic, but actually on the same time, we need the prescription. I mean prescription from the vet actually. So they should diagnose actually what the disease. Yeah, in the farm. Later they can use either for prophylactic or for treatment. Yeah. Because the doses of the prophylactic is not the same as for treatment. So if they continually use antimicrobial or antibiotic for prophylactic, maybe the MR can come. Yeah, because sometimes like anticoccidia, they use I think continuously from one day. Yeah, broiler, especially. Yeah, they continue until they sell in the market, right? So yeah, of course, in breeder they have the what we call the target when they want to use, but still we need to, if possible, we avoid to do that.
Maybe may I just go back to the point from this morning's talk on livestock transformation, because Dr. Kashan pointed out we cannot continue the way that we are doing now. I guess there is a problem. If we just continue that, we have a problem, but then continue doing the same thing, we're not going to move from it. We need to think around the issue,
become a culture,
to be able to address the problem. I think, for example, yes, prophylactic medication is a solution, but then when we think about it, if the facility is not clean, if your genetics are not optimal, you cannot expect animals to grow in a speed that would be under these conditions. Maybe this is not a standalone, the removal of antimicrobials is not a standalone action. As we remove, we should also make sure that other practices are made in place so we do not fall into that same cycle of making the same mistakes. I always equate this as putting perfume when you don't take a bath. So I guess we need to take a bath first, like make sure the farms are clean. Biosecurity is important. They are vaccinated. You have the right genetics. You have the right feeds to be able to expect them to be as productive. I think what dumping antimicrobials might not be let's not resort, because we know it's not sustainable. We know it's not sustainable. How do we go around this? Maybe there are alternatives to explore, but I think it's really coming together with an open mind that we cannot expect difference when we keep doing the same thing. So I guess this is where innovative minds need to come together and finding solutions as a collective action.
I contribute to the discussion. I think sometimes when we sit and talk among our colleagues, we are probably looking from the veterinary angle and what we can do. But actually the problem is bigger than what we are looking at. For example, I just want to give you an example. Like we know if you go into a closed house system in broiler production and so on, or even swine production, your chances of reducing mortality or preventing infection is better with a better system in place and so on. But that ties up with the price of commodities and what the consumers are willing to pay, and what the government is controlling the price of chicken. And all this plays a part. Okay, for example, in Malaysia, we say, okay, we're going to move into closed house system and reduce those use of antimicrobial. For sure, if you have better housing system and so on, the tendency to use these antimicrobial will be much lower. But will the farmers invest on this kind of system when the price to sell the commodity is cheap, has to be cheap. If it's not cheap, then the government controls the price. And so what does a farmer do? And this is a problem, it's a bigger problem to convince them. We say, okay, please go into closed house system. We know there's 10% mortality when it's open house system. If you go on a closed house system, it's 3% mortality because you can control diseases better. But there's no incentive to move towards that, for example. And they continue using the open house system, which is more susceptible for infection to come in. And then you have to use antimicrobials, and it's the whole ecosystem. Do you understand what I'm saying? So I think we should need to look in a bigger picture. Why the farmers are not converting the closed house system? Because the price they sell has to be cheap. If not, the government says, no, it's too expensive, you cannot sell poultry at such and such price. So what do? Yes, we know. There's a system, there's innovation. Closed house system has been there for 20 over years. And these are really issues in the developing countries. Because animal protein, they want animal protein as a cheap source. They don't want to pay more. So I can tell you from our own experience in our country. And that's challenging. So I think sometimes we say, okay, do this, innovation, yeah, we have to move to closed house system. Oh, we've been trying for last 20, 30 years, but still 60 to 70% of the broiler production is still open house system. And when you use open house system to prevent mortality, they put a lot of antimicrobials. So I think that's something I want to put into this discussion for us to think how to go around this problem. Then the other part is, I just wanted to, before I forget, it's about alternatives. Just now our friend from India mentioned about alternatives. A lot of conferences or papers say, we should move to other than antimicrobials, replacement and so on. But still, it is not commercially available at the price we want. And still it's little research or not enough research. There's no recommendation. Nobody's giving the right recommendation how to use all these alternatives. So the farmers have no choice, apart from a quick choice of antimicrobial to put in their feed or water. And this is a real problem. And let's think about that and also see how we can provide that kind of solutions to our farming community. Thanks.
Yeah.
Dr. Mehta is raising her hand.
Oh, yeah. Before Dr. Mehta Mekanon, I would like to acknowledge as Dr. Joy mentioned, so we in FAFA already established the small group from several countries. So I would like to acknowledge first Dr. Swarai Rakisjova from India, and then Dr. Michael Indrawayudi from Indonesia, Dr. Che Leung Woon from Malaysia, Dr. Oi Pek Tong also from Malaysia, Dr. Rajesh Kumar Chaudhry from Nepal, Dr. Anjay Kumar Shah from Nepal, Professor Dr. Rong Roje from Thailand, Dr. Mehta Mekanon from Thailand, Dr. Jeon Soo Oh from Korea, Dr. Ho Seong Cho from Korea, and Dr. Eugene Mende here from Philippines, and Dr. Raul Maquiling Bero also from Philippines. So this is the technical working group. So here also join Dr. Mehta Mekanon and raise hand. Please, if you want something to talk, please, Dr. Mehta Mekanon.
Hi, everybody. Good afternoon. or have the practice guideline for them to do the susceptibility on the key pathogen in their farm, maybe 1 or 2 times a year. Then they can surveillance for the respiratory pathogen and enteric disease, systemic disease at the farm or at the slaughter, at the clinical site, or run some for the vaginal swab like this. And for them, every farm maybe have the different susceptibility of the antimicrobial. So in this way, they can the veterinarian in the farm or even the paravet in the farm can choose what is the proper antimicrobial to use, maybe half years or 1 years, and they can change this again. I ever do it before when I have the company support, and the farmer, especially for the integrated farm, the large farm, are very success in this way, and also they feel good from that. And the second thing is that to run the clinical practice, I have another opinion that the size of farm will be limit of the practice. Maybe you have the size of small size, like for the pig farm, small size farm, medium size farm, large farm, or integrated farm. Maybe this is the limit, the real limit. Because as we do the surveillance, open house or closed house, evaporative cooling system have the same thing. The disease, the same thing. The problem of AMR also the same thing. But the difference is how can they do the practice. Small farm cannot do as good the similar thing as integrate or larger size farm. So we need to provide the practice that they can do according to the size of the farm. And okay, and another thing that maybe we could not focus only for the antimicrobial use, but we need to support something that can replace antimicrobial. Okay, not only the supportive like butyric acid, short chain fatty acid, or acidifier or other, but also can be some bacterial vaccine like in swine, like mycoplasma. Not only mycoplasma hypopneumoniae can form mycoplasma hyoneus, mycoplasma hyosinovae, also streptococcus, gazellella, APP, E. coli, and hemorrhagic E. coli or salmonella. If we have effective vaccine, so this also can replace for antimicrobial for the control of the disease also. So this is maybe we need to find out or need to support the researcher to do this. Yeah, I think this is all my comment. Thank you.
Oh, thank you very much, Dr. Mehta. It's really going in detail by the experience of her experience in Thailand. Yeah, it should be very, very valuable suggestion, right? For
For the technical working group
yeah,
to come up with the recommendations, but maybe we can help them simplify what will matter the most, because it's just too broad. And I think the more you think about it, the more you try to refuse the math problem before us. So maybe it's good to simplify the questions also so that it's doable. For example, should we focus just on managing and bacterial diseases in swine? Something like this. Do we simplify it? Something like about swine that will help manage antimicrobial abuse in swine. Maybe it can be that. But the technical working group, I think this is simplifying the question before them. and will leverage on the pool of expertise from the region. I think this is very valuable to have like the insights from their long-term experiences in the
Yes,
field.
it is.
How do we manage
Yeah.
to reduce the antimicrobial use in swine farms, for example? Maybe we can formulate, but something that will continue to be meaningful for use by veterinarians.
Yes.
But I
Thank
think,
you.
I
Yes,
think-
please.
Yeah,
Dr.
I think
Mende.
Meta summarized it in 3. If I could, I just want to summarize it, Dr. Meta. 1 is to clinically confirm the infection.
Mhm.
Second is to improve production before using antibiotics. That's very possible because APP, Streptococcus, Staphylococcus, and Glasser's disease are basically production problems more than infection problems. And the third is to prioritize the development of vaccines in bacterial diseases instead of rightly going antibiotic use. I think that. Any more inputs from the other members of the committee?
Yes. Dr. Rungrod, Professor Rungrod is still with us. Yes, Professor Rungrod, please.
Okay,
Thank you.
additionally from Dr. Mehta, I like to, show the any organization like for in our faculties, we got the WHO that they do like by Dr. Lung Tip, and unfortunately that she cannot be here for today. She had many information in terms of AMR that been used in the swine farm and been found. So I think this scenario can be sure that if we have many small farmer that that's gonna be in the near future if we don't have much African swine fever situation, then we can have some guideline that Dr. Mehta mentioned. So the TSVA in Thailand try to provide many CPG, and if we can eliminate some virus, then the bacterial complication in the farm may be maybe found lower level that what we seen in the past. And in terms of the situation of the African swine fever, we can see that right now people try not to get in contact with the animal much. So maybe the situation that we find out on the bacteria may be lower, but once the small farmer start to come back in the game on in terms of repopulation, so we might need some CPG that let them do the farming system to be like we want. And in Thailand, I think before COVID-19 and before African swine fever situation, we start to have some regional duck use in the farm, and we limit it, and we need to have the veterinarian to be the one who prescribe and recommend to into the farm. And so far, I think in Thailand, the situation on AMR, we start to have some surveillance and watching. And I think Dr. Lung Tip have some information on that. And I think it's a good start, to harmonize the thing that what we do in Thailand and maybe in other country, and to see that what we can do, for FAWA to recommend on that. So I think that that's all for me right now.
Yes, thank you very much. Yes, thank you very much, Professor Lunglod. Yes,
I think that brings
please.
me to what comes to mind also is that the key points already mentioned here could probably be the backbone for principles to prevent, because the same principles I think will also be helpful in preventing other diseases. But for example, how do we make it happen? Because it's easy to say like, yeah, biosecurity. Maybe this is where the tackle box work will be made more relevant. So I guess what the technical working group would recommend, we will also try and match with available information, maybe from countries, from partners, from FAO. We have a lot of initiatives already that has been documented to work. So I guess making it accessible so that when the recommendations, it doesn't stop with just recommendations from the technical working group, but making it, how do we make it happen? I guess maybe that could be an approach that.
Yes, thank you very much. Especially we have a very nice comment and input from our technical group, right? And what about Dr. Rajesh? Dr. Rajesh from Nepal, are you still with us? Yes. Yeah, so if not, but anyway, today we will record all the comment and along our panel discussion. I think we also will send the link to our FAWA technical group. So after that, we will work as the under the technical support by the FAO as well. So before I think I have one more information that right now, in addition with from Professor Bang that about our FAWA technical group, we have additional another one countries from Japan. Really very appreciate that. We have Dr. Kasumasa Kurei and also Dr. Satoshi Otake from the SWI practitioner from Japan, right? So he also will join us in the FAWA technical group. Yes, so we have altogether 14 FAWA technical group that I confide that this technical group should be a dream team for running the backbone, as Joy said, that for the forming or developing the regional guideline. And of course, it should be named as the FAWA regional guideline for the swine priority disease. And it is something that we are really agree that should be on the respiratory disease, right? Yes, I think I hope that this is something, the goal that we are going towards to do that. Yes, do you have anything for additional comment or something before we go into the final session?
It's an open process, so maybe inputs from the others will be also welcome, and that
yes.
I think it's going to be an ongoing work.
Yes, of course, we are really appreciate all the support and all the initiative that give FAWA a lot of things that going forward to the AMR strategy. And of course, right now we are doing on the FAWA AMR pledge. I think
maybe,
this...
sorry,
yes?
Dr. Chair, maybe just also to acknowledge and thank the technical working group who have agreed to be part of this. Maybe challenging task, but I think meaningful outcomes from the work. Thank you from all of us.
Thank you, Joy. Yes, I really appreciate it already because the FAWA technical group, they have their job, they have a very busy, but anyway, the thing that they have done is such a great contribution to our profession for on the AMR and also the FAWA antimicrobial stewardship, right? So in the time being, we have already started for the initiative for the FAWA AMR pledge. So we will start from now onwards, right? So there are some veterinarian want to do already. How can I say it? Yes, maybe. Yeah, but we will do it later, and of course we will keep you in the loop and know what is going on. Yes, I think we are coming to the final session. Maybe I would like to ask our team, do you have any additional?
It's been a wonderful and a productive afternoon on AMR sessions. And at this point, I would like to share to everyone that our initial move in our booth to sign numerous veterinarians. As of this afternoon, we already have 50. I think because our kit initially it's 120 boxes and now it's only 40 boxes. So
Thank you for your kind interest. Thank you. Yes.
Okay, so thank you very much to the panel discussion today, and of course, I believe that there is still many things to be discussed, but time is limited, so we will have another chance, and we close this panel discussion. And before we leave this, I would like to invite all the panelists to have yeah. Yeah, already. Yeah, yeah. Yeah. Okay. Thank you. Thank you.
Thank you so much.